All right. Well, good morning, everyone. It is just a minute after 9. I'm sure a few people will still be rolling in. But hello, good morning, and welcome to the 2021 Downeast Living with Cancer Conference presented by the Maine Cancer Series. My name is Matt Dexter, Director of the Christine B. Foundation, and simply just one of many members on the conference planning committee. And I have the joy of starting today's program and welcoming you and thanking you for joining us. From now until about 12:30 or a little after that, we'll be weaving through great speakers and discussions, and the schedule can be found in one of your latest emails attached to that, the same email that you accessed the Zoom link with. And we'll be using and encouraging the chat feature with Zoom, and also asking that you use the raise your hand feature for those that want to participate in questions and discussions after each of the sessions. We're also asking throughout the program today that we use our mute button and stay muted until the question and answer part. We'll have people monitoring the chat so we don't miss anyone's thoughts or topics or questions, but we do ask to use the mute button to reduce any background noise and make sure our speakers' voices can be heard. And as you might have just saw, a little pop-up window, the conference will be recorded, and that is really just to offer this program and those resources to those who can't be in attendance today. But we want to let you know that any discussion afterwards won't be shared or used. We want to maintain everyone's privacy during the discussion after every session. So as much as we hope this conference will be interactive and engaging, we know that you may need to get up, walk around, use the restroom, grab more coffee or tea. There will be a few break sessions throughout the morning, so we did schedule that in to not interrupt any of the speakers as well. And although many of us might be here for the first time, some of us might have attended the Downeast Living with Cancer Conference in the past. We have incredible sponsors and incredible members of the planning committee that I want to just take a moment and invite you to sincerely thank. At our gold level, we have Bar Harbor Bank and Trust, the Beth C. Wright Cancer Resource Center, the Christine B. Foundation, and our incredible silver level sponsors today for this program are Downeast Community Hospital and Mount Desert Island Hospital. And also extending a big thank you to our Living with Cancer Conference committee members who have been working very hard the last many months on bringing this program right to your home or office. That includes Nancy Files, Angela Focusato, Barbara Gill, Paula Huntsman, Nadine Lewis, Michael Riesman, and John Rosenfeld. So with that, I have the honor of now inviting Jack Frost to this virtual stage to say a few words and introduce our keynote speaker for the day. Jack is joining us as an incredible community leader and member of Bar Harbor Bankshares, who he's been affiliated with since October 2017 as Vice President, Director of Community Giving. He oversees the bank's charitable giving efforts across all of its markets, not only Maine, but New Hampshire and Vermont as well. Jack previously worked for 10 years in development and fundraising as Executive Director of the Maine Coast Healthcare Foundation in Ellsworth, and also as Director of Philanthropy of the Eastern Maine Healthcare Systems Foundation. Jack, truly, sincerely, it's great to see you. I want to thank you again for the long time relationship and support that Bar Harbor Bank and Trust has provided the conference and many other resources. And I welcome you to the program.
Excellent. Thank you, Matt. That is quite an introduction. And terrific job. Also, my thanks to the entire committee for many years pulling this session together. It's truly important and so helpful in going through the agenda for this morning. Terrific job with lining this up. I am very pleased to represent Bar Harbor Bank and Trust, and as Matt said, joined the bank 4 years ago and have the pleasure of working with so many nonprofits across northern New England and Maine, New Hampshire, Vermont, and Beth C. Wright Cancer Resource Center, and so many others do such a terrific job of supporting our community and those in need. I have the pleasure of introducing Dr. James Jarvis this morning, and really, really, truly enjoyed Dr. Jarvis. All the presentations I've seen over the past more months than we want to count now, but over the past year and a half, he's just been steadfast with his attention to detail and calm demeanor and just words of guidance for all of us working through this pandemic. Dr. Jarvis, James Jarvis, is a practicing physician and the director of clinical education for Northern Light Eastern Maine Medical Center, overseeing the research and education divisions. He has served as the clinical lead physician for Northern Light Health's response to COVID-19 since early on in the pandemic. He was trained in the U.S. Air Force, where he went on to serve as a triage officer for the 56th Medical Operations Squadron. He is a McAfee Fellow of the Hanley Institute and the Heller School for Social Policy and Management, as well as past president of the Association of Family Medicine Residency Directors. Dr. Jarvis currently serves on the faculty of the University of New England College of Osteopathic Medicine and is the University of Maine Institute of Medicine, serves there as well. He has been with Northern Light Health for 13 years. And when I do these introductions, I try to look up some fun facts. So when you Google search Dr. Jarvis, you learn some different things. There's a lot out there, of course, but my understanding is he went to Wright State University, the Wright State University was named to honor aviation pioneers Orville and Wilbur Wright, who we're all familiar with, their history. They invented the world's first successful airplane in their Dayton bicycle shop. So I tried to find a link in. One of my favorite activities, I know Matt's as well, is biking. So nice to be reminded this morning when I looked this up that the Wright brothers got their start producing bicycles. So for Dr. Jarvis, thank you again. To put you on the spot here, I also found the mascot for the Wright State University as the Rowdy Raider. So I'm going to ask if you happen to know what the Rowdy Raider actually looks like or is impersonating.
I remember it from my days in medical school, but I don't think I ever heard the history behind where Rowdy Raider got his name from.
So it's I did learn that his favorite book is The Three Pigs. So he's got quite a history there. So if those of you who want to learn more about this just fantastic school that you went to, they can do a Google search on their own for Rowdy Raider. And thanks again for joining us.
Well, thank you, Jack. I appreciate the introduction, and I appreciate the committee for asking me to speak. I actually did live around the corner from the original bicycle shop that the Wright brothers had built their first aircraft at when I was in Dayton, and I loved my time there. And frankly, it's probably what started my career in rural medicine. Dayton, while being a city, is surrounded completely by rural America, and in fact, the medical school's primary education location was in a very rural part of the state, and so I had to drive past cow pastures to get from my home in downtown Dayton to the medical school. So I appreciate that. For me, it's really important for me to be here for a number of reasons. One, as Jack stated, I've been trying to be a voice of reason during this entire pandemic. Giving out factual information as best we know it at the moment. I remind people that if you ever look at some of my television interviews from the beginning of the pandemic, I am certain that I said things that were incorrect. They were correct at the time, but as we advance knowledge, things change, and so I recognize that in myself, and I think it's important for us to all recognize that knowledge always marches forward. And while things may change because of that, doesn't step away from the importance of us spreading knowledge. The other reason why this is important to me is that my 20-year-old daughter is a cancer survivor. And so she lives with the fear that many of you live with every single day, and that's a shame. So she was diagnosed with an osteosarcoma, a bone cancer, when she was 10 years old. And she is my rock and my hero in my life because she handled that with such incredible strength and grace, and continues to do so 10 years later. And thankfully, she remains cancer-free after about a 1.5-year journey of hers of multiple surgeries and lots of chemotherapy and lots of hospitalizations. And but we had a scare right at the beginning of the pandemic. She had an acute illness. We didn't know what was going on. Thankfully, it turned out to be just a weird presentation of a disease that adolescents get. But it was scary because the world was kind of burning at the time, and we didn't know what was going on. And we also knew that she was immune compromised, and so I'll kind of address some of that as I go along. I really want this to be kind of conversational, but I will lecture, I guess, for a little bit, and just kind of go through a few things and then get to your questions. I want to start off with just a very brief history of coronaviruses. Coronaviruses have been around since antiquity, though they were not discovered until later on in life. They got their name coronavirus because under an electron microscope, we could see that fuzzy coat that goes around them that they love to show on every single newscast when we talk about coronaviruses. So it was very late in life, or very late in time when they were identified, very different than influenza, which got its name actually during antiquity, and was recognized as a pathogen a long time ago. Coronaviruses infect us on a regular basis. In fact, it's estimated that about 60% of all upper respiratory infections or colds in adults are caused by coronaviruses. So all of us have been infected with coronaviruses since the time we were little. And because of that big, thick coat that they have, they do not generate an immune response that has lifelong immunity for us. So it's not uncommon for someone to have a cold in the beginning of cold and flu season and then have another cold at the end of cold and flu season because our immunity to coronaviruses wane. And that's where we have trouble now. So we identified certain coronaviruses in the past that have done more than create colds. The first was SARS-CoV-1, which was in the early 2000s. It affected mostly in Eastern Asia, and at the time, it was alarming for us. Those of us that kind of look at things like pandemics and public health were really afraid that this was going to be something that would spread quite rapidly. Thankfully, even though the people who contracted SARS-CoV-1, and the acronym there is Severe Adult Respiratory Syndrome, is what SARS stands for, got its name because people who contracted the virus had severe respiratory illnesses. It wasn't as infectious as we thought it was going to be, and frankly kept under pretty good control. But it did have a culture shift and change for people in countries that were affected, particularly Korea, Japan, and China. That they were so fearful of that people in an everyday part of their life started wearing masks to help prevent the spread of respiratory infections. Many of us in the West started to, even make fun of individuals that we saw wearing masks on a day-to-day basis. But frankly, they were the smartest of all of us, and I wish everybody had followed their lead. A few years after SARS-CoV-1 came on the scene, we had another coronavirus that caused devastating disease, and that was MERS, or the horribly named Middle Eastern Respiratory Syndrome. I say horribly named because we shouldn't name respiratory viruses or any infectious disease after a location, because it becomes a stigmatized thing and makes people think either that there's something wrong with that particular part of the world or that the disease remains in that particular part of the world. And that's not what happened with MERS. It did not just stay in the Middle East. MERS continues to be a significant problem in certain areas. There are outbreaks, but again, like SARS-CoV-1, not nearly as infectious as we thought it was going to be, and so therefore we're contained. But then early in 2020, we had recognized that there was a new virus that probably was out there since sometime mid to late 2019, which is now named SARS-CoV-2. Why? Because it resembles very similarly SARS-CoV-1, and it creates the same kind of severe adult respiratory syndrome that we had seen with SARS-CoV-1, and so that's where its name came from. The disease itself is called COVID-19, which stands for coronavirus, with an infectious disease, and the 19 just stands for that it was first identified in 2019. So in early 2020, we saw this starting to emerge out in Asia. It was very concerning because it seemed to spread far more rapidly than SARS-CoV-1 or MERS did. And knowing our experience from those other two coronaviruses, that we felt that this could be something that would be extremely problematic. In January of 2020, I was at a conference where Dr. Shah attended as well. And I remember distinctly he and I at the cocktail hour kind of being off on the side, having our own little conversation, and saying, hey, there's this thing out there, what's your thoughts on it? And he gave me his thoughts, and I gave him my thoughts. And at the time, one of his siblings was in Africa, and as many of us talk about with pandemics, we always fear what happens in the continent of Africa. They have an incredibly high rate of HIV infection. They have a very poor healthcare system, and as you know, geopolitically, they have issues as well. And so we both felt that Africa would be hit extremely hard with this virus. Didn't really have much concern for the Western world. We've handled pandemics in the past fairly well. We were both wrong. Africa initially in the spread of this virus was spared, and it was Western nations, particularly first world nations, that were hit the hardest. And we saw that spread happen. So that was in mid-January of 2020. By mid-February of 2020, I was tasked to take on the role of incident commander for clinical applications at Eastern Maine Medical Center. That lasted for about 1 week when I was then asked to take that on for our entire health system. I started to do look at research and do predictions, and looking at particularly an Italian model that I found just on the web, and saw that they predicted what happened in Italy very accurately, and I used that model to predict what would happen here in Maine. And then I looked at that somewhere around March 15th would be the time when we would start to really see that here in the state of Maine we would be affected by COVID-19. On March 16th was the day that we as a state decided that we were going to curtail all non-urgent procedures and shut down our primary care practices in the inevitability that we would see a surge in patients that would overwhelm our healthcare system. It was just shortly after that, in April, that we saw our first cases, our first hospitalizations, and our first death, to something that we had never seen just a few months before. And so it was an interesting kind of time for me in my career, but it was a devastating time for us as people of the world. We all remember that lockdowns occurred, that we stopped our economy in many ways. We were very, very lucky here in Maine. We were so proactive in our state that we prevented what we saw happening on the West Coast, in our southern states, and in other New England states, where truthfully the alarming rate of spread of that infection caused overwhelming critical care needs that we had never seen before. And we all remember seeing those pictures of healthcare workers who were treating patients in hallways or in trailers while they themselves were wearing garbage bags as protective equipment. We never saw that in Maine, and it's because we were so proactive here. And it's also because one of the proudest things I can think of living here in Maine is that as a state, we immediately came together. You know, as many of you are aware, there are no public hospitals in the state of Maine. They are all private hospitals. Many of them belong to health systems. Many of them are independent. But we never saw each other as competitors when this hit us. We saw ourselves completely in collaboration. We worked with the state. We met on very regular basis. We shared information. We shared each other's staff. We did a lot of things that you don't see happen anywhere else. I was in constant contact with colleagues in Boston, and they would say hospitals that were literally across the street from one another had never spoken together. And yet I, every single day, spoke to my counterpart at Maine Health. Many people consider Northern Light and Maine Health constantly in competition with each other, particularly those in the Augusta area where we both would like to have a little bit more market share. But that's not the way we acted. And so we should all be very proud of that. So what was different about this virus than what we have seen? First of all, it acted like no respiratory virus. It acted nothing like influenza, and in fact, acted nothing like SARS-CoV-1 or MERS. It caused multi-system organ failure, something we never saw with respiratory viruses before on any large scale. Yes, we know some people have influenza who do develop those, but that is a rare thing that happens with influenza. Typically people who need critical care simply have a really bad pneumonia, and that's usually what we need to treat. We also found that it caused prolonged disease post the acute phase. People continue to have cognitive deficits for months, maybe even years after the infection. People continue to have pulmonary and cardiac conditions that we've never seen last long-term from respiratory infections. In fact, up to 50% or maybe even greater of people who have been infected with COVID-19 have what they would describe as fatigue for months on end afterwards. And so those are things that we just never saw before, and they're concerning for us as we look towards the future. We all remember that we started talking about masks, and initially the conversation was around that we needed to protect our healthcare workers and our first responders, and so we implored people not to go out and purchase masks because we needed them to protect ourselves so we could continue to take care of you. We then started to figure out that maybe masking was a good idea, and there was about 1,000 different YouTube videos and Pinterest groups that taught people how to make masks, and we appreciated all of that. And we remember that we were quarantining people for simple things like traveling outside the state to Boston for a day and coming back. And then, of course, more and more about lockdowns. And so our world changed, and that happened in a very, very short period of time. But what have we learned since then? We are so much smarter now than we were before. We have treatments now for people who have acute COVID-19 that we never had before. For those with mild to moderate symptoms, particularly those who are at risk, like people who have cancer, we have monoclonal antibodies that if used in a time frame early on in the course of that mild disease has been shown to prevent hospitalization, severe disease, and death. In the state of Maine, we have done a tremendous job in using monoclonal antibodies over the last few months to help prevent loss of life in our state. We developed new antivirals, such as remdesivir, that have been used in patients to help mitigate the disease. And then we've learned so much about just the kind of care that we need to give to those people with severe disease. We learned that high dose oxygen was much better than ventilating support. If we looked at any other respiratory virus, when people start to become compromised, we intubate them very, very early and use mechanical ventilation. What we found, unfortunately, with COVID-19 is that actually increased mortality for them. And so we try to avoid that as all possible. We learned that we had to use the right amount of steroid in order to affect change. And we learned that proning or putting people on their stomach actually improved their condition. Not very pleasant for the person who has to do that, but it's a life-saving technique. And then we learn there's a host of things that just don't work. And we continue to see, things pop up in the media that says, oh, try this, try that. But because of the way that we do things here in the United States and using the scientific method, unfortunately, we just found that many of those things that may have promise, we find that they do not. We talked more about prevention and learned more about prevention. So masks, we learned that masking did help prevent the spread of the disease. And that was important for us. Initially, all we knew is that it helped prevent, if I had the infection, it helped prevent me spreading it to you. Eventually found that if you were wearing a mask, you actually helped to prevent you catching the infectious disease yourself. We know more about masking than we did. I was very famously saying, hey, listen, if a neck gaiter is more comfortable for you than wearing a mask, wear a neck gaiter. We don't recommend those anymore because we found that they were not as effective as masks. We know that cloth masks, if they're double layered or triple layered, provide more protection than if they're single layered. And we know that surgical or procedure masks provide a layer of protection more than that. And then the gold standard of an N95 or a KN95 is better. The problem is they're expensive, they're in short supply, and we still need them for healthcare. Hand hygiene. We always knew hand hygiene was the way to prevent respiratory illnesses. I've been saying that for a long time, every time I talked about influenza. Physical distancing, though. I do not recall ever telling people that they should remain 6 feet apart from every single person that they come in contact with during flu season. I wish I had, because we probably could have saved countless lives in that as well. Wellness. We know that people who are well or try to be well do better with this virus than people who are not, though this virus does not discriminate and certainly infects well people. But trying to take care of oneself, their mind, their body, their spirit, certainly has a productive outcome. And then lastly was vaccines. And vaccines really are just a marvel of science. We have had the technology to use messenger RNA for medical reasons back since the 1970s. So that's a long time ago. So this is nothing new. In the 1980s, there were advancements made in that technology. Unfortunately, they could not find a way to make them work. Similarly, in the 1990s and the early 2000s. But companies started to realize that this could be the wave of the future. And when in early February, I think it was February 2nd, the Chinese scientists who were working on coronaviruses released the genetic code for the particular virus that causes COVID-19. They released it to the entire world without asking for any kind of recompensation for that. And because they shared that information freely, 2 days later, Moderna developed the first vaccine against COVID-19. 2 days later. That's amazing. And that's because they already had the building blocks in place, the machinery in place, the technology and the skill in place. They just needed to know what it was that they were going to build. And so the release of that genetic code allowed that to happen. And so that then translated into Pfizer following suit. Pfizer, because it was a much larger company than Moderna, was able to recruit a whole lot more people to do their studies, which is why they beat the rest of the market to having an authorized vaccine. Behind them came Johnson & Johnson, which uses a viral vector mechanism, but very similar to the mRNA technology for their vaccine. And then there are many other vaccines around the world. Those are the 3 that are authorized here in the United States. Primary series is really important. So making sure that everybody that started a vaccine series completed their vaccine series. For Pfizer and Moderna, that initially was considered a 2-shot series. For Johnson & Johnson, a single shot. But as we knew, coronaviruses, like I said, the immunity against coronaviruses do not last. So whether that be due to infection or vaccination, we knew that immunity would wane at some point, and we're seeing that now. And that's when we started talking about people in vulnerable populations, particularly those immunocompromised, including those being treated currently for cancer, particularly with chemotherapeutic agents, that they actually needed to have an additional portion of their primary series, or what we call a 3rd shot for Moderna and Pfizer, or a 2nd shot for Johnson & Johnson as part of their primary series. At the same time, we started talking about booster shots for those people who do not fit into that particular category. And booster shots now are available for all 3 of those vaccines. For Pfizer and Moderna, it's about 6 months after you completed your primary series. So for most individuals, that would be 2 shots. For those immunocompromised, that would be 3 shots. For Johnson & Johnson, the booster shot is actually recommended for all individuals who have received a Johnson & Johnson 2 months ago, and so a much closer time frame. And in fact, it seems more like Johnson & Johnson should have been a 2-shot vaccine all along. Booster shots are recommended for any individual who's over the age of 65 who have received Pfizer or Moderna. For those people 49 to 65 years of age who have underlying medical conditions should receive the booster. And for those 18 to 49, they should consider it if they have underlying medical conditions. Anyone over the age of 18 who works in an occupation that puts them at risk, such as a healthcare worker, a first responder, a teacher or school worker, a grocery worker, a food service worker who comes in contact with multiple different people in the community on a regular basis as part of their occupation, it is also advisable that they get a booster shot. And then this week, we got the fabulous news that we now have an authorized vaccine for children ages 5 to 11. And so Pfizer is now authorized for that. It's a different dose than the one that we give to adults, but it is the exact same vaccine, a messenger RNA. So where are we now? Over 700,000 Americans have died from COVID-19. Life expectancy decreased last year for the first time in many, many, many years. For men, life expectancy decreased by 2.3 years, and for women, 1.6 years. And some people say, well, that's not a whole lot of time. But as many people on this call know, every day is precious. My daughter tells me that on a regular basis. She lives for tomorrow because it's the only day she has. And so a loss of 1.6 years or 2.3 years off of a life is a lot. And the only way you can do that with a population of 350 million people is a loss of life for young people. And that's unfortunate what we have seen. There are hotspots scattered across the United States. Colorado just made the announcement yesterday that their hospitals may refuse care to individuals because they are so overwhelmed with coronavirus patients that they cannot take care of other patients. I do not recall that ever happening in the United States before. That is an amazing and horrible thing to think about. Thankfully, here in Maine, we have not had to do anything along those lines. Rural communities now are hit the hardest. Initially, this was a virus in the urban centers, but it is now a virus of our rural communities. In Maine right now, the case rate is 36 per 100,000, or 470 new cases of coronavirus every single day. Unfortunately, the predictive model that has been the most accurate, in my opinion, for predicting what happens in Maine, that's from the Mayo Clinic, predicts that in 2 weeks, that number will rise to 40 cases per 100,000, or 540 cases per day. We are one of the few places in the country where case counts continue to rise while things happen around the rest of the world. And of course, now we all have COVID fatigue. We've been dealing with this for a very long time. As Jack said, I have now been doing this for, I believe, 20 months. I don't know how many interviews I've done. I shudder to think what Jack found when he Googled me, because I'm sure many of it was just my picture on a newspaper or a video thing. I'm tired of what I'm doing, and I wish I didn't have to have done this. I wish I'd never had to do this at all, but I certainly wish I could stop doing it. But even today, I was alerted about a severe outbreak in one of our communities that may have long-reaching ramifications for us. And so we will continue to live with this as we go along. I have next to me my crystal ball. It reminds me of two things. One, it doesn't do anything, it just sits here. And two, I have no real predictive value, but this is my predictions for the future. We will continue to see spikes of the coronavirus occur for a considerable amount of time, and maybe forever, like we see with influenza. I do believe coronavirus will eventually become a seasonal virus and will mirror very similarly to what we see with seasonal influenza. I also fear that there will be new mutations that arise. If you remember, we started with the original SARS-CoV-2 virus, and that was bad enough. It mutated to the alpha strain, which may or may not have been more infectious. Then we mutated to a Delta strain, which was certainly far more infectious. Whether it caused more disease, we don't know. It may simply be a fact that it infected so many more people, we saw more disease. And we know other mutations have occurred. And as long as the virus exists in human communities, further mutations will arise. I do feel that boosters will be likely. I do feel that they will probably be an annual event like we see with seasonal influenza for two reasons. One, I think mutations will arise that will cause us to have new strains of the coronavirus that are infectious. But also, again, human beings just do not get lifelong immunity to coronaviruses. We never have, and we probably never will, and therefore booster shots will be necessary. And then the thing that, people always ask, what do I fear the most about this pandemic? And it's not this pandemic, it's the next one. There will be some other infectious agent that comes onto our planet that has another devastating prospect for us. And it's making sure that we are prepared for it so that we don't go through what we went through this time. So now what I was asked to talk about, how do we live with this? And I reflect back on my daughter. She is a sophomore at the University of Maine. She lives in the dormitories. Her final year of high school was interrupted, so she did not have a formal graduation. She had a drive-through graduation, which I loved because it was fast, it was convenient, and it kept people safe at the time. But that's not the joy that most kids wanted to experience at the time. Her first year of college was marred by most of her classes being remote. The absence of parties, again, as a dad, I was happy about that, but I understand the importance of the social development there. This year's been better. All of our universities in the state of Maine, I think, took a courageous step by mandating vaccination. And I think that's a wonderful thing that they did that. They put more mandates in place and enforced those mandates about social distancing and masking better than anybody else, because they had a community that they had to protect, a community that was constantly interacting with one another. They lived with each other in the dorms. They went to classes together. They ate together. They did all those things. So for them, world's a little bit better, but it's still weird. I still don't want my daughter to go to movie theaters. That's a personal choice on our part. I'd prefer her not to go to large setting parties, but I understand she's 20 and needs to explore that part of the world. So I do insist that she wears her mask and has hand sanitizer on all times. So we need to recognize that infections exist. We have been in denial about that for a very long time. I was asked once, why didn't we do all these things to protect ourselves against influenza if you think they're important now? And my answer was, we probably should have. We just felt that the loss of life that we got that happened due to influenza was something we could accept. We probably shouldn't have accepted that. You need to continue your care. You can't stop doing the things that you need to do to stay well, whether that be cancer treatments, treatments for heart disease, treatments for high blood pressure, treatment for diabetes, or whatever. You need to do that. One of the sad outcomes that we will find from this is that when we shut things down because we had to, we now are dealing with the after effects of that. Cancers that went undiagnosed that now are so far advanced that we have to do far more treatment in order to receive a cure than we would have had we done those earlier. People who neglected their other chronic conditions, people who ran out of medications because they didn't want to ask for refills, because they didn't want to go to a pharmacy. These are tragedies that extend beyond what coronavirus itself did. So we need to continue that. We need to remain up to date on our preventative services. There are other vaccines that are important for all of us to get based on our age and our certain circumstances, and we need to get those. And we need to do our cancer screening, and nothing's more important for somebody who has cancer or had cancer than to make sure they don't get another cancer. And so doing those preventative services are incredibly important. We need to live life like we want to live life, but we need to avoid certain exposures. And those who are at high risk, particularly those who are cancer survivors or those undergoing treatment, really need to kind of do that measurement. I encourage you all to wear masks when you are indoors in a public setting. You have no idea what the person next to you, what their conditions are, or whether or not they are infected. And we know that masks, even cloth masks, help prevent the spread of the disease from one person to another. If you are not yet vaccinated, I implore you to get vaccinated. The 3 vaccines authorized in the United States are exceedingly safe. We are talking about hundreds of millions of people around the world who have been vaccinated with these vaccines, and we have seen nothing of any major consequences to that. Now, there'll always be people who say, well, I know somebody, and that is true, because no matter what we do, nothing is 100%, and there will always be one-offs, but the one-offs in this case are incredibly small, and the benefits of the vaccines are incredibly great. And hand hygiene, I just can't say it enough. Wash your hands. Use hand sanitizer. My kids always joke that I've never passed a hand sanitizing unit and not used it. I've always been that way. I love to brag. I once won a contest that I had the cleanest hands in a hospital. That's a hard bar to reach. But unfortunately, as my wife will say, it is my fear of pandemics that caused me to wash my hands that much. Not so much OCD. If you could see really what my office looks like rather than the picture in the screen, you will see that my desk is a mess and I am not as organized as I claim to be. And then lastly, it's about priorities. What's important to you in your life? What is it that makes life worth living for you? And how do I prioritize the risks so that I can take care of those? That results in difficult conversations. I remember when my children were very young, as Jack said, I was in the Air Force. My family was very far away from my wife and my family. And so visiting was always an issue. And at the time, my father-in-law was smoking. And I said, we will not come and visit you and stay in your home as long as you continue to smoke. A very difficult conversation my wife wanted to have with her father, but could not. So I did it. I set my foot down. He quit smoking. We went and visited. Now we have to have more of those difficult conversations. If you're unwilling to wear a mask, if you're unwilling to get vaccinated, I'm not sure I can visit with you because I can't put my health and my life in jeopardy because of actions on you. My mom asked me recently if she should allow her sister to come and visit her. Now, everybody in the family completely vaccinated. But my aunt does live a very different life than my mom. She does interact socially a whole lot more and does not wear masks. And I said, Mom, if it was me, I would have her wear a mask while you're indoors. If it was me, I would try to maintain that physical distancing as best that you can. And if it was me, I probably wouldn't let her sleep there for the night, because my parents are in their 80s. They're at risk just by age. They have some health concerns. Difficult conversation, but one that needs to be had when you talk about your priorities. And with that, I think I'm done pontificating, and I'd rather hear the questions that you all have. And so please put them in the chat or raise your hand. I don't know if I have a moderator that'll do that. Look at those things for me. I see a couple of heads nodding yes, so that'll be appreciative. But I thank you for the time you guys have given me to talk. I will continue to say that I have the greatest job that I wish I never had to have. I am so proud of what Mainers have done and the work we have done, and I will continue to work for the safety of all Mainers. And with that, I'll take questions.
Hi, Dr. Jarvis. I'm Amy Kerman, and I'm the program coordinator at the Beth C. Wright Cancer Resource Center. And I'll be monitoring the questions and answers today for you. First, let me just thank you for your presentation today. We've all benefited from your very thoughtful words, from the very history of the coronavirus to your personal interactions with it, and explaining things like the difference between the coronavirus and what we've had to deal with in the past. It's very enlightening. So I'd like to start the ball rolling with a question, if I might, and that's
please,
about,
Amy, thank you.
Yeah, that's about folks who have already contracted COVID, and what are the recommendations around them getting the booster shot or even starting a series of preventative measures?
Yeah, so we've always suspected that that infection, while it does confer some immunity, that immunity was probably not going to be specific enough or lasting enough. And recently, the CDC just published their data on looking at a very large scale group of people, and have found that yes, indeed, those that had immunity from natural infection did not last as long or give us as much protection as those who had been vaccinated. And so the recommendation continues to be, regardless of infection status, that people get vaccinated. And the same goes for booster shots. If you fit in the category for a booster shot, even if you've had an infection prior to your primary series or a breakthrough infection since the primary series, the recommendation is still to get a booster shot. What we do know is that people who have had an infection with coronavirus and survived, that if they get the vaccine afterwards or a booster after a breakthrough, that their antibody levels are actually even higher than those individuals who were vaccinated and had never been infected before. So they may even have an added layer of protection. But what we do know now definitively is that vaccination is a far better protection than immunity conferred from infection alone. So thank you for the opportunity to clear that up.
Great, thank you. We've had a question come in. It says, thank you for leading this work with Northern Lights and for your presentation today. What is your opinion on the value of HEPA filters in closed spaces?
Yeah, so I was very lucky to work on a state committee that kind of talked about things that we could do to reopen our economy, and air circulation was a big factor for us to discuss. I think that while there are benefits to added purification of air or filtration of air using things like HEPA filters, I think the biggest thing really is air circulation with bringing in outside air. I look to the airline industry, and a lot of people feel that, oh, the worst thing you can do is be on an airplane because you're just breathing in all the same air. But that's not what happens with the jet engine airliner. The same turbine that sucks in air and then forces it out the back end of an engine, that same air is actually what recirculates in an airplane. And so airplane has the most recirculated air of any indoor location. And there are many ways that you can believe that. And I hate to be gross, but when someone passes gas on an airplane, if the air wasn't recirculated, we would all know that. And yet we almost never realize that that happened. And we all pass gas all the time. And it's because air is recirculated. It's not filtered in any way, shape, or form, but because it does that, it actually makes the air very safe on an airliner. That's very different than many of us in our businesses where that air is often not recirculated, or if it's recirculated, it doesn't include outside air. So the primary thing is getting outside air into that recirculation. If you have the ability to do HEPA filtration, that's fine. We haven't found any value that I am aware of with things like UV light and other aspects of trying to improve air quality. So good question.
Thank you. Nadine, you have your hand raised. Would you like to unmute and ask your question?
Thank you. Good morning, Dr. Jarvis. Good morning, everyone. I'm the one that's been communicating with you from the
Yes, thank
Beth.
you. And I apologize that our hospital security system blocked your email.
That's okay. It was fine. We were just getting a little
We have to block
nervous.
every viruses out, including
Yeah, right.
digital ones.
Yeah, I have a personal question. After getting the vaccine, I ended up getting COVID and ended up in the hospital. And I'm just baffled. I guess what, I'm not really sure what my question is. I guess my question is, how the heck did that happen? And also, how do I make a plan, or any of us make a plan going forward with this huge, uptick in cases?
Yeah,
you.
so
Thank you for
Nadine,
being
thank you. So one, I wish that hadn't happened to you. But remember, nothing is 100%, and all of us have a different immune response to everything that we give. So when we talk about numbers, those numbers are always global numbers. They're population numbers. But when you're a population of one, only the one matters. And so we always knew there'd be breakthrough cases. So if you remember, we started talking about particularly Moderna and Pfizer, that they were 95% effective of preventing severe disease, hospitalizations, and death. That's astonishing numbers. Every year with influenza, if we get up to about a 40% efficacy with a flu shot, we are very happy, because we know that people's immune system acts in different ways, and we know that viruses have a way to sneak around immune systems. So the fact that we created vaccines that were so incredibly efficacious, I think it makes it more, we got complacent a little bit, and we forgot that nothing is 100%. And so, so when we hear those breakthrough cases, I continue to get asked, well, if they're breakthrough cases, why should we get vaccinated at all? Because if we didn't, we wouldn't be talking about breakthrough cases. We'd be talking about is mass devastation of people of the spread of disease without vaccination. And so unfortunately, there'll always be breakthrough cases. Some of that has to do with circumstances. You come in contact with somebody who had just such an incredible viral load that they were able to overwhelm your immune system when you breathed in all of that virus, or was it innate to your own immune system? And unfortunately, we probably will not have the answers to that. But the good news is that the vaccine probably still protected you from having even worse disease or a worse outcome like death. And that's really what we're trying to do. We do know that the vaccines also prevent actual infection. That's a relatively new discovery for us. Initially, the reason for creating them was to stop the stem of severe disease and death. So.
Thank you. We have another question. We've all heard a lot about herd immunity. Do you foresee that our region, Maine, Northern New England, will obtain herd immunity in the next 3 to 6 months?
So again, I'm going to take out my crystal ball that does absolutely nothing. If you do watch some of my original news briefings, and I got asked about herd immunity, I said that it would take about 80% of individuals in communities to be immune towards coronavirus for us to see any kind of herd or community immunity of any significance. And I think I was probably a little bit more accurate in that than some other individuals. And that really had to do with the Delta variant. So if we stay with the original strain, probably 70% of vaccinated, which is, Maine is above that now, and will be even further now that we can do individuals who are 5 to 11 years old. But the Delta variant, with its highly infectious spread, changed the game on that. So when we talk about things like mumps and measles and rubella, when we hit somewhere around 70–75% of a community being immunized, that herd immunity factor kicks in. It's really why we require those immunizations for schools, right? A confined population of a high-risk population that very readily spreads respiratory viruses, needing to be at that 70–75%. Unfortunately, we are far from that in the United States in terms of coronavirus. I believe the U.S. now is hovering around maybe 60%, maybe even a little bit lower than that. And we know there are populations where only about 35% of the community is vaccinated. Unfortunately, we live in a world where we travel all the time, and so you have somebody from a pocket of a place that only has a 35% vaccination rate. That still allows for a high spread of virus. They go to a population where there's a 70%. That's enough to overwhelm that 70% and the herd immunity. So I think, unfortunately, it's still going to take some time for us, and really is trying to get that last remaining part of the population that is so hesitant to get vaccinated to rethink that and to look more globally rather than personally, and look to see how they can improve the health and well-being of the entire community by getting vaccinated. Now, when I talk about vaccine, there are 3 things that vaccines do. They protect you yourself from disease. They protect the people that care for you from disease. And then they protect the entire community from disease. And so those 3 things are important. And it's the last one that we really need to overcome.
Great, thank you. John R., do you have a question for Dr. Jarvis? Would you like to unmute yourself?
Yeah, thank you. Hi, Dr. Jarvis. Excellent presentation. So my question is deals with the booster shot. I guess I'm not quite sure because I see different information. That's an unfortunate part of all the news is you get mixed messages. So in your recommendation, should you get the booster shot from the original shot company you went with originally? Or is there some benefit for going for a different company? I know I've seen or heard that if you had Johnson & Johnson, they recommend you actually get a different brand of shot for your booster shot. And so I'm confused by that. I wonder why you would get a different one. Why not stick with the same company?
Yeah, so for Moderna and Pfizer, it probably doesn't make much of a difference whether you stick with the same one that you got originally or switched to the, so if you got Pfizer, if you switched to Moderna, there's probably not a whole lot of benefit in doing that. But it is clear that Johnson & Johnson, and remember, Johnson & Johnson's efficacy was always a little bit lower than the other 2. Tough to compare those apples to apples because they were created at different time frames. The studies were done at different time frames. Johnson & Johnson certainly had a delta effect that the other 2 did not in their study research. But we do know that the immunity with Johnson & Johnson vaccine is waning a little bit faster than the other 2. So there is evidence now that if you were to switch from Johnson & Johnson and get one of the messenger RNA vaccines, either Pfizer or Moderna, that boosts your antibody response and probably your immune response better than if you just got a Johnson & Johnson booster. It's still perfectly acceptable to get that because, again, we're still talking about numbers in the 60s and 70% efficacy range. So still much higher than we talk about with most other vaccines. But to have added protection, you could get switch from Johnson & Johnson to one of the other 2 and get a little bit better immunity from that. And so that all of those are acceptable practices.
Okay, thank you.
And I will just, for clarification, I received Pfizer originally, and I did receive a Pfizer booster for me, not for any other reason than of convenience. It was what was available when I was eligible to receive all of those.
Yeah, thank you.
And I have no financial interest in any of these companies, by the way. I have no idea if I own stock in any of them. I just have no idea.
We have one comment, Dr. Jarvis, that says you mentioned staying well by maintaining treatments. Could you please include encouragement for general wellness such as adequate sleep, exercise, fresh air, stress reduction, drinking water, and it goes on and on. Do you have any thoughts about that?
No, I agree. I had said, it's taking care of the mind, body, and spirit, right? All the things that are important to you as an individual, and finding ways that have you be healthy. Activity, social contact. These are things that stimulate our body and improve things. Doing things that improve your mind. I often talk to my patients who wonder, like, I'm forgetting things. I'm just not as sharp as I was when I was younger. Ways to stave off a lot of that is by doing things like puzzles or reading or things that stimulate multiple parts of your brain at the same time. So I'm a big fan of Sudoku. I'm a big fan of crossword puzzles. I am a huge fan of reading. And so doing those kind of endeavors that stimulate things. If you're into art or music or theater, doing that helps, again, to stimulate the whole brain and gives you a general sense of well-being. A general sense of well-being then relates to a general sense of wellness. And so taking good care of yourself is the primary thing that you can do to keep yourself well. So great point. Thank you for that. And I agree with pets. So I have 3 dogs. So over in this corner, here's my Batman on this side, and over on this corner is my 3 dogs. So
Excellent.
I surround myself with the things that are important to me. Somewhere in front of me, actually, my family. I can see them right off the bat. So.
I'm with you there. And I also appreciate your thoughts on just generally living your life, and continuing to focus on what makes you feel happy and well. We have one more question from Michael. Michael, would you like to unmute?
Yeah, and this was emailed to us by a member of our committee. If one is tested positive for COVID, what steps should they take to get immediate and effective treatment?
Yeah, that's a great question. So if you're in a high risk category, so if you have a health condition, if you're currently being treated for cancer, or the feeling is that your prior treatments left you immunocompromised, if you have other conditions like heart disease, lung disease, diabetes, you really should reach out to your provider. I will tell you that Northern Light Health right now is working on a system where individuals themselves will be able to go online to look for appointments for monoclonal antibodies. The key with monoclonal antibodies is you want to have that done quickly. The best time is within the first 5 days of testing positive to prevent severe disease and hospitalizations. Monoclonal antibodies they're just incredible that we're able to do that. And so reaching out to your provider to find a way that you can access that is the best thing to do. And also making sure that you're getting any other treatment that may be necessary for you due to an underlying condition is important. If you're well enough to stay home, please stay home. That's what we'd like you to do. Don't go out in the community and spread it anymore. If you can separate yourself from the members of your household, that is also advisable. And then wait till you're feeling better in the quarantine period. If you think you need healthcare, seek healthcare. Do not wait. I just heard an unfortunate story of an individual who stayed home for 10 days while they just got worse and worse and worse. And unfortunately, by the time that they did present for healthcare, we didn't have anything to offer them. And so if you feel the need to seek healthcare, please do so. So I'll answer the last question that I just read in the chat there, because I think it is an important one. The question there is this an individual who was diagnosed with cancer on March 16th of 2020? So that day that I mentioned, their workup, including scans, biopsies, were delayed due to the fact that we were taking precautions with the virus. So looking back, was it a wise choice in hindsight? And I think it's too early for us to tell that. What we can say is that we had to do prioritization on our end, like everybody has to do on their end. And for us, the priority was being able to remain open for what we expected to be an overwhelming wave of patients and needing to be prepared for that. I was fortunate enough to be the facilitator for what was famously known as Work Group 4 among the state. So the commissioner of the Department of Health and Human Services and the governor had formulated 5 committees to work across the state on improving things, and mine was around capacity. And the prediction was that Maine would have 1,000 people admitted to hospitals who required ventilators. At that time, we had 275 active and working ventilators in the state of Maine. Clearly, 1,000 we could not take care of, and that was the patients on ventilators, did not include those patients that weren't going to need ventilators. Fortunately, because of the actions that we took, we never saw those kind of numbers, and so we never had to do those. So protecting in the moment was the thing that we had to do. I think more would be the question is, why did our healthcare system fail like this? Why weren't we better prepared? Why do we not have the redundancies necessary? Why did Maine have only 275 to 300 ventilators that they could utilize with none in a stockpile that we could pull reserves from? Why did we run out of PPE? Those are the questions that I think are going to have to be answered. And in answering that, say, what can we do to prevent ever having to do what I still feel was necessary and right back in the beginning of the pandemic? And so I'm hopeful that the discussion will turn from how do we acutely deal with COVID-19 to how do we be better prepared for whatever the next pandemic is.
Okay, thank you. I think we are going a bit over time. Dr. Jarvis, if you can give us one more question from Matt. Matt, do you want to ask a quick question?
Sure, I can do that.
Thank you.
And I'll be quick, but Dr. Jarvis, thank you for the presentation and answering questions. There's been a statistic that I've seen a lot that the American Cancer Society put out, and they anticipated in 2020 about 8,300 new cancer incidents would occur across the state. And that same report, that same metric of gathering this number, the American Cancer Society is anticipating over 10,000 for 2021, which is about a 20% increase in the state. I was curious what your perspective is of that increase, and any thoughts on how we could be a little proactive with making sure in 2022 there's neither a great increase or any increase, and how we might be able to help.
Yeah, so prevention, of course, is key, and early detection is next. And so I think we need to work our efforts to that. Again, I'm very proud that since June of 2020, Northern Light Health was able to re-engage in doing preventative procedures and diagnostic procedures, and we have not had to curtail those to any large detail during the rest of the pandemic. Clearly, that is not the case of every health system and hospital in the state of Maine. We're fortunate that we had the reserve to be able to do that and manage things to be able to do that. And so I think, we have to put a concerted effort on that. I continue to hear from my surgical oncology specialists that they continue to do procedures, both diagnostic and curative or treatment on individuals who, because of delayed care, unfortunately wound up with more advanced cancers than they would have had that happened sooner. And that will continue. It will take us a while to get through. Even just a 2-month, 3-month delay has ramifications for a prolonged period of time that we don't see as we, until we go on. And we continue to try to ramp up things like, doing mammographies and screening colonoscopies and the like. We are still well behind where we were before, and we need to catch up. And we will continue to do those endeavors. And I think, that's really what we have to focus in on. And then again, if there's any inkling that there may be something going on with you, you need to be vocal and active. Our healthcare systems are still incredibly busy and overwhelmed for lots of reasons. And so it behooves you to speak up to your healthcare provider and say, listen, something's just not right. I don't know what it is, but something's just not right, and kind of push for making sure that they are doing all the things that they need to do in a timely fashion. So I appreciate the ability to say that one more time.
Great. Well, thank you so much. I know we could go on and on with questions to you, but thank you for giving our attendees this opportunity to ask you direct questions. And thank you again for your presentation. It was so informative.
Well, my pleasure, and thank you for having me. And it's very important. And I'm always available to come back again if you'd like. And I appreciate this. And please enjoy the rest of your conference. I hate to be rude, but I do need to go attend another call. Unfortunately, we may be having another outbreak that I have to deal with. So.
Oh dear. Okay. Well, we'll let you go. Thank you again. And Michael, are you going to take over?
Yep. Hi again. Thank you, Dr. Jarvis. I'm Michael Reisman, Executive Director of the Beth Wright Cancer Resource Center, and I have the honor of introducing our next speaker. And even though we ran over a little bit, we don't despair. We have a break scheduled for after this talk. After this talk, so we will have wiggle room to extend this presentation a few minutes. Again, it's my honor to introduce Susan Corbett, and she'll be talking about connecting to your healthcare provider. Susan is a preeminent authority and advocate for digital equity and digital inclusion, and works closely with economic development and rural organizations to promote broadband adoption. In the fall of 2017, Susan launched the National Digital Equity Center, a program of the Axiom Education and Training Center, collaborating with local and global change makers, relentlessly driving disruptive strategies to close the digital divide in Maine and across the United States. She is the director of the National Digital Equity Center now. Ms. Susan is a former chief executive officer of Axiom Technologies, provider and advocate of fast, affordable, and reliable broadband services for rural communities. In 2005, she joined Axiom Technologies as chief financial officer. Under her leadership, the telecommunications company designed and constructed more than 100 access points, connecting more than 2,500 square miles in one of America's roughest terrains, rural Maine. She's written and managed numerous grants for broadband development and adoption. And it's my honor. I've had the honor of working with Susan a lot in the last year, and I've seen her PowerPoint, and it's a great presentation. So thank you, Susan, for being here today.
Well, thank you, Michael, and thank all of you for inviting me to join your discussion this morning. And also just a shout out to Dr. Jarvis. It is always a pleasure for me to listen to him, and he is indeed a Maine treasure. So as Michael described, I am the founder and executive director of the National Digital Equity Center, which has a goal of closing the digital divide here in Maine and across the United States. We've raised about $4 million to provide free digital literacy classes and affordable devices to Maine and its people. We have lots of colleagues and organizations that we partner and collaborate with. And I'm pleased to see so many friends and colleagues that I've crossed paths with over the years in the attending this conference. So I'm going to go ahead and share screen. All right, can you all see that? Yes, okay. So we're going to talk today about connecting to your healthcare provider. Okay, so what does connect mean? So we often hear terms called telehealth, telemedicine, video conference, virtual visits. And so what are we talking about when we talk about those particular words? So one of the things we need to know is, can you connect to the internet? Do you have a broadband connection? Do you have a device to connect to the internet? And what kind of devices connect to the internet? We are tablets, iPads, Kindles, Android, laptops, desktops, smartphones. What digital literacy computer skills do you need for a telehealth visit? And what software program is needed for your telehealth visit? But first, let's talk about what digital equity and digital inclusion is. So digital equity is a condition in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. What does that mean? When the pandemic hit, we were really concerned about the people who were going to be left behind because of our digital economy. So there were students who didn't have a broadband connection at home, or maybe not enough of a broadband connection to connect to the internet. Maybe there were multiple people in the family that were connecting to the internet to connect either to school or from remote work. There were remote workers who didn't have an internet connection or not enough of an internet connection, or maybe not the equipment to participate as a remote worker. And then the group that I was most concerned about were our older adults who were already battling isolation and loneliness, And then we have a shelter in place order. And how many of those older adults didn't have access to technology? So we know that digital equity is needed for civic and cultural participation, employment, lifelong learning, and access to essential services. We achieve digital equity by digital inclusion. That includes affordable broadband, affordable equipment, digital literacy training, and public computer access. We're going to talk about those today. Affordable broadband. Do you have an internet connection? Is affordability an issue? So we know that in Maine, we have about a 50% take rate. What that means is that if there are broadband connections in an area, only 50% will take that broadband connection or subscribe to that broadband connection. The number one reason that they don't subscribe to broadband is affordability. And affordability is a different number for every family. There are programs in place for affordability. The FCC has an emergency broadband benefit. We have many ISPs here in Maine that participate in that program. The emergency broadband benefit today, if the family meets the income eligibility guidelines, will provide a $50 per month subsidy. That's going to run out. And when the infrastructure bill is passed, it will be a $30 per month subsidy. National Digital Equity Center holds classes on how to apply for that emergency broadband benefit. So feel free to pass that information along. Also, two of the larger providers here in Maine, Consolidated Communication and Charter Communications, also have an affordability program in their organizations. Affordable equipment. Do you have equipment to participate in a telehealth visit? And what do you do if you need equipment? We do have a program here at the National Digital Equity Center for equipment for income eligible individuals. They have to meet those income eligibility guidelines, and we will provide a tablet with cell connectivity if they do not have a cell connection at home, or if they do have if they don't have an internet connection at home, if they do have an internet connection at home, we have laptops and desktops. We also partner with lots of organizations around the state that have raised funds to provide equipment to their patients or clients. A shout out to the Beth Wright Cancer Resource Center, the Maine Cancer Foundation, and several others who've raised funds for us to provide those devices to patients. There is sometimes an organization might have equipment directly, so always reach out to your provider, healthcare organization, any group that you might be affiliated with. And of course, feel free for anyone to contact us at the National Digital Equity Center about that affordable equipment. What do you need to do before your telehealth visit? You need to be prepared, just like you were going to the office. You need to make sure your camera and your microphone work. My funny story is a cousin who I was pretty technically savvy, had a telehealth visit with her provider, and she kept saying to the provider, kept saying to her, "But I don't see you." And she said, "But I can see you." And they couldn't figure out what was wrong. And then after the visit, her granddaughter came over and she said to the granddaughter, "I don't know what happened." She said, "But he couldn't see me on that telehealth visit." And she said, her granddaughter said, "Nana, you don't have a camera on your computer." And so she just assumed she did. And so sometimes making sure that you do have a camera, that it's working, practicing with someone, a family member or a friend on connecting through video conference is always helpful. Before making an appointment, make sure that the doctors you're interested in seeing accept your health insurance for a telehealth visit. Don't be surprised if they don't and you get a bill. So make sure that they cover your telehealth visit if you have an insurance. Write down your questions, just like you're going to the doctor's office. And then after the visit, ask for a copy of the office visit or a follow-up email. Many physician offices have a built within their medical records program. They can send out follow-up visits, or you might have access to the portal to see what the physician told you. And don't hesitate to reach back out to your provider if you don't understand something later on after that visit is ended. At the National Digital Equity Center, we have a program, a class called Using Technology for Better Health. We have a class on how to video conference with your healthcare providers and also with family and friends. We did a lot of training for families and older adults who needed to connect when the pandemic happened. So we worked with them on both sides to help them connect through video conference. There were lots of apps to monitor health. We had some, so the New England Telehealth Resource Center, Danielle Lauder, helped us create this class, embedded a lot of the programs of monitoring your exercise or diet or blood sugar or blood pressure, monitoring your weight, medication reminders, using Fitbits and Apple Watches and connecting with Bluetooth. So we have a whole class series around using software apps to better manage your healthcare. We also have classes on protecting your digital presence, which is really important, especially for older adults who are getting online for the first time. We want to make sure that you're taking internet safety and protecting yourself from fraud and scams and protecting your online presence. Not everything on the internet is safe and not everything on the internet is true. So we want to help you figure that out. We also know that it's important to create strong passwords so our instructors can help you do that. And that's a good way to protect yourself from any scams that might come your way. We offer free digital literacy classes. Those classes are in 3 different course curricula. There is for work and business, classes like all of the Microsoft products, Microsoft Office, Word, Excel, Outlook, QuickBooks, it's an accounting program for small business, how to build a website for small business and do social and have a social media presence. For work and for home and education, we did a lot of classes when the pandemic started on for educators learning how to use all of the Google tools, Google Classroom, Google Meet, as well as for parents to teach them how to get online, how to help their kiddos get online with their teacher using those same Google platform. Internet safety, for sure, we offer that right across the board on all of our curricula. For parents and grandparents of teens and tweens, we have an internet safety class specifically around that, because those teens and tweens are often smarter than we are and go places they probably shouldn't go. We have, and then the third is aging well with technology. So when we designed that curricula, it was prior to the pandemic. We worked with a group of older adult organizations across the state that helped us design that. Humane Center on Aging, AARP, the New England Telehealth Resource Center, and several others. And so those classes, are again, connecting with family and friends and healthcare providers, software apps, all the internet safety, digital library, how to connect to all your local libraries and download books. And there's a host of other classes that anyone can take. People can take as many classes as they wish. And if they're having a problem connecting to those classes and they need some one-on-one assistance, we have volunteers and instructors that can help with that. We, at onset of the pandemic, we had one of our funders gave us a little bit of funding, and we purchased 100 tablets with cell connectivity, which was not nearly enough of what was needed around the state. So we picked a pilot group. We said, if you're 70 and older and you don't have an internet connection, we will give you one of these devices for 90 days and provide a one-on-one tutor to help you figure out some things just as simple as turning it on. The tablets went out fully loaded. They had a Zoom link to the instructor, and the goal of that first tutoring session was to get the student to click on that Zoom link and become face-to-face with the instructor for the first time. You can just imagine the pure joy of that when that happened. Eventually, with enough one-on-one instructor, the instructors got the student confident enough to take any of the classes. For our older students, it was a great way to tackle that isolation and loneliness. They had, they were with a group of their peers. They could take as many classes. They could stay connected with the instructor afterwards to follow up on any questions. That program spurred a lot of partnerships across the state. And so many of the organizations we work with will raise funds for equipment. And the National Digital Equity Center will provision those tablets, get them into the hands of that organization's clients or patients, and then provide all of the instruction needed for that individual. The main Office of Community Development reached out to us in the spring, provided funding, which allowed us to open the program to anyone that matter their age, as long as they met the income eligibility requirements. So we have tablets with cell connectivity, we have laptops and desktops that are ready to go. For the desktops and laptops, if the student takes 5 hours of our classes, we will issue them a certificate of ownership so they can own that device. And then, of course, that emergency broadband benefit class, which we are offering on a continual basis so that everyone who might be eligible for that discounted broadband can apply. Feel free at any point to reach out to us. I'm going to put my contact information in the chat. I'm going to stop sharing and happy to answer any questions that any of you might have.
Thank you very much, Susan. A great presentation. And does anybody have any questions? I have a few. Maybe I'll start off with one that just starting off with the idea that most of the people here, I guess, are we're preaching to the choir here. People have their own computer or tablet. One thing I did read in the paper about how you're working with Hamden on providing broadband to the town of Hamden, and I saw there was, I saw maybe an article about that. How could, if people and there are people who are online now, how could they reach out to policymakers in their communities if they don't have broadband and reach out to the National Digital Equity Center, or could you tell us more about the Hamden project even?
So the Hamden project is actually an Axiom project. So it's not a National Digital Equity Center project. However, I believe that all infrastructure projects here in the state should have a digital equity and digital inclusion plan. So the reason that I think that that's important, we did a digital equity and digital inclusion plan for the town of Searsport. And when we do those plans, we do a deep dive into the demographics and to understand what are the demographics of the town and what should we be aware of. The community had a broadband committee, and it was made up of town officials, educators, business people, et cetera. It was a nice cross representation of the town. When we did that plan, we found that 25% of the homes had a family median income of $10,000 or less. So for this town, which is looking to build a fiber to the home and raise the funds to do that, addressing the affordability issue is going to be key. And so we just had a conversation with one of the committee members just this past week of how do you create a plan so that you do not make the digital divide even deeper by leaving people behind by building this great new network, but then they can't afford it. And so affordability is a very important issue for all infrastructure plans. It's an important issue for our governor. And so the National Digital Equity Center can work with those communities to help them create those digital equity and digital inclusion plans, and sort of right alongside those infrastructure projects.
Donna?
Yeah, thank you, Michael. Susan, thank you for the wonderful presentation today. It's nice to see you again. This is more of an observation and not something that I think you have an answer to, but one of the good things that I think has come out of the pandemic is the ability to do telehealth for patients from their own homes, from their own devices, in community. You know, I run a small community health center on Swans Island, so patients come to the clinic and I set them up either with a laptop to do their visit if they don't have that ability at home. And this past week, I've been told by 2 of my providers that this is no longer going to be available for patients to do. I was very surprised by that. They said Medicare is no longer reimbursing. They feel that we're far enough into the pandemic that it's not necessary any longer. I was totally stunned by this because this had been such a great thing. Even for myself, I'm a stage 4 ovarian cancer patient. So my provider is in Scarborough and I live on Swans Island. So I have been seeing her via video conferencing from my home. Half an hour later, I'm done with my visit versus a 360-mile drive to Scarborough, an overnight hotel stay, and 2 ferry boat rides. So this came as quite a shock this week when I had asked 2 different providers, a primary care provider and a dietitian who sees some of my diabetic patients out here. And they're like, no, we no longer can offer these telehealth visits to your patients. And I'm like, what do you mean? And they're like, well, June 30th, they stopped reimbursing and our hospital, our overseeing organization will no longer be reimbursed for these, by, different insurance companies, including Medicare. And I find this so disturbing. We had moved to a place where telehealth was taking hold, despite the reason, the pandemic, and now we're taking a huge step backwards on this. Do you have some thoughts about that?
I do. So we call it the collateral benefit of the pandemic, right? And telehealth is one of the #1 benefits of the pandemic. The statistic back a bit ago was that telehealth visits increased by 13,000% across the country when the pandemic happened. And they said that one of the issues with Medicare prior to the pandemic was that it wouldn't pay for telehealth visits. It would pay for facility to facility, but not from home to facility. And they said it would take an act of Congress, and it did. And 2 weeks later, Medicare was paying for telehealth visits. For rural states like Maine, this is huge. This is really huge. I mean, even, I live in Jonesport. On a snowy, icy day, driving to Machias is, to where my healthcare provider is, can be treacherous, right? And so I think that it's important that we get back on track. I would say, we have a great congressional delegation who are very who support telehealth visits, and I would say reaching out to them and getting the rule changed on the federal side to continue to allow those Medicare telehealth visits. It's really, really important, and it's a game changer for rural states like Maine. So thanks for bringing that up. I think it would be an absolute shame not to be able to continue those services for all of our Mainers.
Yeah.
Can I go, Michael?
Yeah.
Okay. Hi, Susan. Thank you so much. I've heard you before, and what you're doing is great. I'm very disturbed by what Donna just talked about. I think that MaineCare is still approving them, which I find very bizarre. Anyway, hopefully we'll get this straightened out. 2 questions for you. Is digital equity what you do? Is it only in Maine? It's only in Maine?
No.
And the other question is, so if, say, we go to our town and our city and we say, we really want to push this, can they contact you? Thank you.
Great questions. So the funding that we have raised, the over $4 million, is for Maine and its people. So all of the classes, all the free classes, the affordable equipment is only for Maine residents. We do work outside of Maine. It's billable, right? So people from outside the state can take any of our classes. We charge a fee of $50 per year. They can take as many classes as they wish. And we have other states and communities outside of Maine that are working with us on a program. When we started this back in 2017 and 18, we felt that Maine would be a great pilot for other states, and it has proved to be so. Our funding is a mix of federal, state, and private philanthropy. We've shown proof of concept that this can work. And then for communities, absolutely, any community that's looking to do any broadband work, for sure, can contact us at the National Digital Equity Center, and I'm happy to help them in whatever way we can.
As we just got a comment in the chat about another recent another casualty is that people in Maine are unable to see out-of-state healthcare, such as oncologists in Boston through telehealth. I guess is that something you're aware of, or?
I'm not aware of, but that was the rule prior to the pandemic.
Yeah. Okay. One question: do you ever work with medical providers on telehealth?
We do. We have several projects that we're working on. One of the older projects was the University of New England and their geriatric program. We got tablets into the hands of their patients and provided instruction for them. We've got a couple projects, Maine General, Maine Health. There's some others that are in the pipeline. And one of the benefits of the National Digital Equity Center is we're small enough to be flexible enough. So there's every organization might have a little bit different twist to what they need done, and we're happy to work with them to make it a successful program for their organization. I also saw in the chat that someone asked how many individuals have been helped by the program in the state, and is it more focused in rural or urban counties, or equally between the two? So we've provided class instruction to well over 10,000 Mainers. People can they can take multiple classes. It's not unusual. Most of our students take, if they take one class, they'll take another 2, 3, or 4 more. So they, and mostly because they're comfortable with the instructors. Prior to the pandemic, our instructors are geographically placed across the state. And prior to the pandemic, we had mobile labs, and we would move from site to site and hold classes, maybe 2, 3, 4 classes in a community, and then move on. When the pandemic hit, we couldn't do that because most of the places we were holding those classes were public libraries, adult education programs, community center, older adult organizations. So we moved our instructors to an online interactive platform, and so all of the classes are over Zoom. We keep the class size small so that there can be good interaction between the students and the teacher. We're starting to slowly see people opening up their organizations, libraries, adult education. And so what we've decided to do was to keep the instructors online, but then create partner organizations where at the local level, we'd have a facilitator bringing in students, and then the instructor would come in over Zoom and to provide the classes. The reason that we're using this model is it means that our instructors will have a further reach across the state. Instead of spending a lot of time traveling from site to site, they can be doing classes and one-on-one instruction. We have, and the question around, urban, rural. So we track, we're data geeks. I tell people, all of our classes are free, but free is not free. Free means that every person participating in our program must complete an enrollment registration form. That enrollment registration form aligns with US Census data. So we're asking questions like age range, family income range, educational attainment range. That allows me to tell you something that 57% of our students are age 55 and older. And the number that I'm most excited about is that 8% of our students are 80 years and older. And that tells me that if you want to learn, you can. We are representing, since the pandemic, we have had students come in from, and we have like over 440 towns across the state. We have had students join classes right now from over 320 some odd towns. So they're representative right across the state. The other benefit too of this, of the instructor providing those classes via Zoom, you may have an instructor in Southern Maine that's really well versed in advanced class instruction, like advanced Excel or QuickBooks. And so now it doesn't matter where the instructor is, the students can join from anywhere across the state. So it's been a benefit for doing that.
Well, thank you very much, Susan, for, again, a great presentation. And we are now going to take a break until 10:45, so you can stretch your legs. Hopefully, you can be back by 10:43, actually. And thank you again. And Paula Huntsman will be introducing our next speaker, Jen Harry, in a few minutes. Thank you.
Thank you.
When you're ready, Paula, we're set to go.
Good morning, everyone. I'm happy to introduce Jen Harry. Jen studied psychology at Penn State University and has worked in the mental health field in various capacities for over the last 20 years. She's furthered her studies and obtained certifications in the methods of Japanese psychology, training in mind-body techniques to reduce stress, and most recently obtained certification in applied positive psychology, which is the science of human flourishing and optimal functioning. She's also a resiliency trainer. Jen currently leads 2 monthly sessions at the Beth C. Wright Center tools for well-being, and a walk your way to mindfulness. Also look for Jen leading Acadia mindfulness adventures on the hiking trails of Mount Desert Island. Thanks so much, Jen, for speaking today.
Thank you so much, Paula. And well, can everybody hear me okay? I just want to make sure my headphones are working okay. Great. Yeah, thank you so much. It's really an honor to be here today and to talk about one of my favorite subjects, which is resiliency. My plan is I'm just going to talk a little bit about what exactly is emotional resiliency. And then I'm going to share a few of my favorite practices that you can try out. And if you haven't already got it, we'll also be sending out a sheet with some of those practices on it. So you will have something at some point and additional resources. So, we've all been living through some really, really challenging times, dealing with this ongoing pandemic, the continuing uncertainty, sometimes being isolated, not being able to do all the things that we used to do. There can be medical treatment delays, and then throw in a cancer diagnosis on top of that. And it's really is a lot, right? People have been experiencing really unprecedented levels of anxiety, uncertainty, and fear. So let's just take a minute, because that's a lot, right? So I'd like everybody to let's just all take a deep breath all the way in and all the way out. And let's just do one more for good measure. All the way in and all the way out. And then let me tell you some good news. There are so many different kinds of tools and practices that can really help us manage the intensity of all of these emotions that we're experiencing, that can help us navigate the ups and downs of life, and that can actually help us bring in and be able to find more calm, balance, and ease in our life as we go through these challenges, things that can really help us meet these challenges. So, and we'll talk about some of those practices in just a few moments. But first of all, I just want to talk about what exactly is emotional resiliency. And so one of the ways we can think about this is we can look, if we take two people and have them come up against the exact same stressful event, one person might be able to go right through it, move through it and bounce back and be fine. And another person might come up against it and then still be struggling years later. So what's the difference here? What allows that one person to move through it? There's a person named Linda Graham who wrote a book called Resilience: Powerful Practices for Bouncing Back from Disappointment, Difficulty, and even disaster. And she describes resilience as the capacity of response flexibility. And so if we look at those two people again, the person who was able to move through the difficulty, they were able to be flexible in how they responded to what was happening. They were able to face the adversity and find ways to deal with it, such as seeking out support, using resources, using tools and practices that allowed them to move through it and still remain optimistic and hopeful despite the difficulty and challenge of the situation. And so emotional resiliency is really learning how to manage these signals and surges of really strong emotion that we often don't want to have, right? Sometimes we consider these feelings negative or difficult. But emotional resiliency also includes cultivating positive emotions, things like self-compassion, kindness, gratitude, awe, delight, and joy. And so having emotional resilience really means that we're able to move flexibly through our emotions and our life experiences without getting stuck. And this is really important because it's not really the emotions that are the problem. It's when we can't move through them. right? So if we get stuck in sadness, we might become depressed or over time. And if we get stuck in having a lot of anxiety over time, that can become panic. And so what we want to do is be able to move flexibly in and out of our emotional states. And more good news is the research shows that resiliency is actually a skill. So that means that it can be learned and built. And through exercises and practices, we can actually increase our ability to be resilient. So doing these practices is kind of like taking our brain to the gym. And we can learn to use, we can learn and use new coping strategies. And even learn something that's really interesting is we can even learn good coping strategies ahead of time. We can pre-wire our brain to increase our ability to be resilient. And we can also rewire our go-to patterns in ways that can help us be more resilient as well. And there's a lot of tools and techniques to do this. And before I talk more about the practices, I would like to just add that human beings are naturally resilient, right? If we break bones, they heal up. The vaccine helps us works in our body to help us be more resilient. And just think for a minute about all of the challenges and adversities that you've been through in your life so far. Because if you're human, we've all had really hard moments, right? And so if you are sitting here listening to me right now, that means that so far you've made it through 100% of your worst days, and you're still here with us right this minute, right? And so we have this natural resilience. That's 100%. That's a pretty good track record. So, we're going to talk about how we can learn to build upon this natural resilience that we already have. So 3 things can really help us build this skill to be more emotionally resilient. And the first is really being able to learn how to soothe and calm our own nervous system. Because what happens is when we come up against a big challenge or a very stressful situation, we automatically go into protective nervous system responses like fight or flight or freeze, right? And it's really hard to operate when we're in those states. So being able to learn how to soothe and bring our body back into a state where we're able to take action is really important. We'll talk about a couple of things that can help with that in a minute. The second thing is, anybody feel like you get stuck in your head and you start thinking about something, and before you know it, you're like on the worst possible situation that could happen in the world? I think we all do that. And, we call these negative thought spirals. We start out, once we start going down that path, we get on this train and it can take us to some dark places. So another thing that can help us become more resilient is learning how to manage and interrupt those negative thought spirals. And I have a couple techniques we can try out for that. And then finally, cultivating positive emotions. Sometimes we think it's hard when we're in the midst of some really challenging times to feel positive emotions. But this is one of the ways that we can help pre-wire ourselves for resiliency, is to spend time intentionally cultivating positive emotions. And this really can help us. Let me just say that cultivating positive emotions doesn't mean we're only thinking positive thoughts, but it means that we're recognizing that even in the midst of challenges, there's still good things. Right? There's still things we can be grateful for, or there's still small moments of comfort and joy. So the more we can practice cultivating these, it can help balance out the difficult experiences and the difficult emotions that we're feeling. So we'll throw in a practice or 2 of that. So starting out with some of the practices, I'm going to share. I have 9 practices on here. And I'm just going to briefly go over them, and you'll receive a sheet that has each of these on. And if anybody has questions, I can talk about this all day long. And so I know this is pretty quick, but I wanted to give you some hands-on things you could try out. And so people are welcome to get in touch with any questions, and we'll have some question time after too. So the first the first technique or practice we can use is what we did just a little bit earlier. Let's all take a deep breath all the way in and all the way out. Yeah, and do one more. One long, slow, deep breath all the way in and all the way out. Do you notice a little bit of a settling effect on your system just taking that one long, slow, deep breath? Yeah, this actually activates part of our nervous system that goes straight to our body's natural relaxation response. And so this is a great practice to use to sort of pause when we feel like things are spiraling out of control. We can pause and just take 1 to 3 long, slow, deep breaths, knowing that we are actually resetting our own nervous system, right? That helps us prevent the slide into fight or flight and stay in a place where we can try to deal with whatever's happening in that moment. It's also quick and easy.
Jen, you muted yourself.
Sorry about that. I was getting all excited about the practices. All right, so yeah, did you hear me say it's free and easy and you can take it anywhere? Yes, okay, great. So that's one practice we can use, especially for soothing and calming our nervous system. Another practice that I think is really important, especially when we're going through any challenges, is practicing self-compassion. If somebody else was going through something hard, we're the first people to be like, oh, you're going to get through this and it's going to be okay. And we comfort the people we care about in our life, right? But we don't always do that for ourselves. And there's a lot of research behind the benefits of giving ourselves the same kind of care that we would give to a family member or a dear friend. So let's all try this practice right now. What I'd like you to do is just put a hand on your heart, just for a moment. If you're comfortable, you can put your hand on your heart. We could just acknowledge that this is some hard times we've been going through, right? So we can just acknowledge it's a moment of, it's a time of difficulty. And then we can recognize that, hey, we're not alone. You're not alone. We're all going through stuff right now, right? We're facing a lot of stuff. So you're not alone in this. And then finally, just give yourself some words of encouragement. What would you tell your best friend or your family member, a dear family member? So, say to yourself, hey, we're going to get through this, right? Or any kind of positive pep thing you can say to yourself that's comforting, right? May I be kind to myself? May I give myself the support I need? These are some of the things that we can say when we're facing these moments of challenge. And so what's happening when you do that, the touch of the hand on your heart actually releases a hormone called oxytocin, which helps improve our mood and soothe our nervous system. And it helps us acknowledge the difficulty and be able to respond to ourselves with some compassion and care. We're learning how to care for ourselves like we do everybody else, right? So it's a life-changing practice. The more you practice it, it's really helpful. Another technique, I'm going in out of order of what I have them on the sheet that I sent you. But I think another one is when we start to experience difficult emotions, we can actually use that as a cue to become more resilient. Because in that moment, we can be, you start to feel it. You start to feel all that rush of emotion and upset and like things are overwhelming. And you could pause for a moment and be like, okay, wait, I think I can respond more resiliently here somehow. What are my resources? What are my choices? What are my tools? And that can help us interrupt that spiral. And we can be like, okay, I can be more resilient. What can I do? I'll take that deep breath, right? Or I'll put my hand on my heart and give myself some comfort in this moment. And then I'll figure out what to do next. So using the difficult emotions and reactions as a cue themselves to help us become more resilient. And along with that is a practice that I really like when things feel overwhelming. It's called 3 options. And so when you're starting to feel overwhelmed or experiencing strong emotion, ask yourself this question: what are 3 options I have in this moment? And they don't have to be big things. We're not solving all the problems of the world or whatever is happening. You can be like, an example is like, I could get a tissue. I could call a friend. I could take that deep breath, right? And just being able to have options is comforting to our nervous system. And it's comforting to us, right? Because we feel stuck when things are overwhelming. So if we know, like, okay, in this moment, there's some things I can do, it helps us be able to move forward in the face of challenges. So that is a really great technique that is very helpful. Another technique I like that helps ground us in the present moment and get out of our mind and into the present moment is a technique called feet, seat, hands, and breath. And let me guide you through that right now. It takes a minute and that's it. So it's easy. So everybody right now, I'd like you to find your feet. Just feel the sensation in your feet. Maybe press them against the floor. Can you feel the pressure? Can you feel the warmth of your socks? Just whatever your feet feel like. Maybe they feel chilly. Just really feeling into sensation. Now move to your seat and just feel your seat. You might feel pressure. Maybe you're sitting on a comfy cushion. Maybe your seat's hard. Just feel whatever sensation from the inside. Just without judging it, just noticing what it feels like. And then moving to your hands. Feel your hands and any sensation. What are they touching? What does that feel like? Can you feel air on them? Just noticing sensation in your hands. And then finally, your breath. Find your breath and just noticing the sensation of breathing. Maybe you can feel the air coming in your nose. Maybe you can find all those little movements of expanding and contracting as we are breathing in and out. Just noticing that sensation. All right, so that's it. Do you feel a little more grounded in this moment? Were you out of your head for a couple minutes? I mean, literally a minute, but didn't that feel nice to be able to just sort of ground into your experience where you are? So this is something that's really interesting because basically if we let our mind go wherever it wants, takes us to some wild places, right? And every human being has something called a default mode network, and that's our go-to places in our mind. And what's interesting is when we do a practice like feet, seat, hands, and breath, and we're in our actual experience, we have another network called the direct experience network. And the two can't work at the same time. So if we want to get out of our head and the thought train that's taken us where we don't want to go, if we ground into sensation, into our body, maybe our breath, maybe just how our feet feel, it helps counteract that where our mind would just naturally go, right? So that's a fun one to do and try out. Another one to pre-wire. We talked about pre-wiring us to be more resilient. And Rick Hansen, who teaches a lot of neuroscience techniques to be more resilient, he suggests that several times a day, you check in wherever you're at and look around you and say to yourself, in this moment, I'm okay. So let's do that. Look around you. Notice things around you and wherever you are. Notice if you're warm. Maybe you have a blanket. Maybe, you had a snack during the break. You're in a safe place. In this minute, we really are okay, right? No matter what's happening. And so doing this regularly, throughout the day helps us, one, soothe anxious thoughts, because we're like, actually in this moment, anxiety tends to be in the future. We're wondering what's going to happen in the future. And so if we come back to this moment and notice we're okay, and we practice this regularly, it soothes those anxious thoughts. It soothes the nervous system, and it helps train our brain to seek out cues of safety from our environment as a regular go-to. So when you do meet a challenge, you can come back to this and be like, okay, something's here, but in this moment, I am okay. And this practice can help us become more resilient and give us a pause so we can reset and figure out how we're going to move forward. Just a couple more. Am I running out of time? If I am, I think I have. Okay. Change or what ifs. This is a great practice. A lot of times we're like, what if this happens? And what if that happens? And I can't do this. And oh my gosh, and what if this happens? So retraining our go-to places in our thoughts is really good. And so we can counteract, we can interrupt that. So what we can say instead is, what if everything goes great? Doesn't that feel different? What if everything works out perfectly? And if we ask ourselves this question, it interrupts us going to that place we don't want to go. And then it gives us the possibility, like, what if it does work out great? What does that look like? And so that really can, if we can do that every time we start to what if, it brings us back to a place where we're calmer and more able to do things. There's a couple other things, only 2 other things on the sheet, which you'll see if you have questions. One's just keeping a gratitude journal, because that helps counteract negative. We go to the negative. And then the other is to start training yourself every time you start to go to the anxious thoughts, replace it with a different thought. Like, I choose to focus on what I can control, instead of what I can't. Or, it's all going to work out. Just saying these things over and over helps rewire our brain, because we often have these go-to places that aren't quite as spectacular and don't help us feel better. So all of these things, all these practices are something you can experiment with. I recommend you pick 1 or 2. Try it out, experiment. The research shows that the brain learns best with just little bits and very often. So small experience repeated many times. So basically you could have 30 minutes of practice, like 1 deep breath in and out, and do that 6 times a day. And if you do that, that actually equals 3 minutes of practice. And the research shows that 3 minutes of practice a day actually can create a permanent resource of resilience in your brain. So it doesn't take a lot. It doesn't have to be hard. It can actually be fun trying out these new things. So I hope I'm not over. I get so excited. I could talk all day long about these things, but I hope there's a couple minutes for questions, and people are welcome to reach out to me on my email or call anytime. And yeah, so thank you.
Thank you, Jen. That was great. That was awesome. We do have all your information, and we'll be sending those out tomorrow to the people that are attending. Does anybody have questions? You can type them in the chat or just ask.
I have a really quick question. Hey, Jen, how you doing? And I'm glad to hear you. Can you tell us why we might go to the negative as opposed to the positive? I think Jen's frozen.
Jen, if you can hear us, we can't hear you or see you. Michael, we can't hear you either.
I guess I could, I bet she's gonna try and come back on. Is there another question? Is all I was gonna say. Can anybody else answer that question?
That
This
The
is Tracy Parker from Adult Community Health and Counseling, Adult Mental Health. I'm a nurse care manager there. I would say, just personal opinion that, you know, sometimes you go to the negative because, you know, traumatic past experiences, you know, low self-esteem. I just, you know, from working with mental health patients for as long as I have, and like I said, from personal experience, when you've been through trauma and have been treated like you've been treated in the past, it's very hard to break that cycle. And it's very easy to get to that negative space very quickly and very hard to get out of it once you are spiraling. So that would be my guess.
Tracy, I'm sorry, I somehow got bumped off the internet, but I'm back and I'd like to respond to that.
Sure.
Yeah, that is exactly true. But also part of it, what happens about going to the negative is all human beings are wired to go to the negative. And studies show that we actually are more likely to have like 7 negative thoughts to 1 positive thoughts. And that's really because we, you know, it's a survival thing. Like people sitting around watching the beautiful sunset might get eaten by a tiger, and the people, you know, watching the beautiful, the people who are worrying are more likely to see danger. And so all people are predisposed to go to this negative place. I find that it's really helpful, no matter, you know, especially if people have gone through really challenging experiences. It's really helpful to know that everybody has this, and also that it can be changed. And it's, you know, it's not a fast and easy change. All these things are practices, which means, you know, the more we practice them, the better it gets. But we can't, like, you know, do it a couple times and expect it to work. We really have to work at it. But thank you for pointing that out, because with trauma and things like that, it definitely is something to keep in mind and work with.
Jen, there are a couple questions in the chat. One is suggestions for severe insomnia during treatment. And the other one is looking for links for the studies that you mentioned, the benefits of mindfulness.
Yes. So insomnia, that feet, seat, hands, and breath can be really helpful for helping us fall asleep, because we are tuning into body sensation. Contact points is another way to say it. So paying attention to any contact points that are like where your back's hitting the bed, right? Anywhere and really feeling sensation and scanning through every point of your body that you can feel helps us switch out of that default mode network, which might be keeping us awake, right? With all the thoughts and things going, swirling and going on. And so practicing that, that's probably one of my big go-tos for insomnia, and it can be quite helpful. And then, yes, I have there's one of the things that are the other question is there's some books on the sheet going out has a resource page that has some information. It has some books with some of the information and things I'm talking about here, as well as apps. So you can check those out. And if you can't find particular sources, just get in touch with me because I can help. But I think a lot of the information is in those books.
Thanks so much, Jen. If you want people to contact you, can you put your email or whatever, however you want us to contact you on that sheet as well? And the best you write, we'll get the sheet out to people tomorrow.
Okay.
Thanks so much. This was awesome. And Michael's giving me the time's up. Thanks. Thank you.
Thank you.
Hey everybody, I'm Angela Focasato. I'm Cancer Patient Navigator here in Washington County, and it's my pleasure to introduce Sam Williams. She is going to talk about being in motion with cancer. It's an interactive wellness demonstration she's going to do. Sam is she's certified as a cancer exercise specialist. She also is certified as an RYT 500 yoga instructor and as an American Council of Exercise certified personal trainer. She provides strategies to start moving and stay moving. In partnership with the Betsy Wright Cancer Resource Center, Samantha leads an ongoing weekly virtual exercise class based in Machias. Sam has held this class in person for many years and hopes to return to live in-person classes as soon as it's safe and possible. In addition to these classes, Sam is the founder and owner of Bold Coast Yoga School. She's a yoga teacher and she certifies students and trains them in yoga and programming. Welcome, Sam.
Thanks, Angela. Appreciate that. I'm really happy to be here with you today, and I'll be offering some options for mindful movement, which it sounds like goes really well after Jen's discussion. Jen, I just caught the second part of your talk, but that was really lovely. And one thing we encourage in Be in Motion is mindful movement. It really helps give mind and body a chance to reconnect. I'm going to go ahead and spotlight myself so you can see me. You're welcome to move with me. Nothing should hurt, so please skip any movement that doesn't feel good. Or if there are certain recommendations that are coming from your doctor about how you should or shouldn't move, please follow those over my advice. Our Be in Motion class is a range of folks, some who are survivors, some who are actively in treatment. And we'd also welcome caregivers to the group too, because caregivers greatly benefit from the stress reduction and often share some of our movement ideas with those that they're caring for. So just a couple quick thoughts on benefits of exercise for people who are in treatment. We have some good studies that show the chances of physical side effects like fatigue, neuropathy, lymphedema, osteoporosis, nausea, things like that. We have some good research that shows that exercise helps lower the chance of those side effects and can lower the severity of those side effects when they occur. One of the benefits you probably have heard is reducing the risk of depression and anxiety. And that's especially when we're in the course of treatment. Keeping us mobile and as independent as possible is also a huge benefit. Preventing muscle loss, and in many cases, even being able to build up a little bit of strength can be tremendous. I'd heard a question about insomnia. Exercise during treatment can help improve sleep. It can also help prevent weight gain and obesity, which are sometimes linked to an increased cancer risk. And there are some studies that suggest that exercise helps make treatment more effective. So it can be really useful during the course of treatment. I know you don't always feel like moving. So in Be in Motion, we offer lots of options to just stay seated while you move, which you certainly can should you participate in the demonstration today. Or if it feels good to get up and move, even just for a minute. Good research shows that if we've been seated for more than 20 or 30 minutes, that starts to have some effects in our body. And they did a really cool study where they had people who worked at a desk job stand up every 20 to 30 minutes, just for 1 minute. And one of the results from that study was it cut their risk of type 2 diabetes almost in half. It was by 45%. So if you're up for standing up, I'd invite you to join me. And we'll walk through some of the movements that we often use in our warm-up in Be in Motion. And these come from Dr. Paul Lamb. He's a classically trained doctor in Australia, and he's also a world Tai Chi champion. So he brought in a lot of his knowledge of Tai Chi into this warm-up that gives motion for every major joint in the body. And the first thing we do is we just walk around and take a little stretch and squeeze with the hands. And so after you've been seated for a little bit, this helps your blood get moving again. This sends the signal to your body that you're going to do something. And if you're choosing not to stand, you might still just take and reach your arms up only as far as it's comfy with a stretch and squeeze. I'm going to tip you down just a little bit so you can see my feet better too. And then we'll find just a gentle little shake. These little shakes help to reset the nervous system. They reset the amount of tension we hold in the muscles. And trying to keep your knees soft if you're standing. We'll go ahead and float the arms about shoulder height. And then draw the hands in as if you were bringing something up to smell. And then we'll reach out and float the arms down. So they're lifting up. And you can think of gently drawing the head and chin back as the hands come close. This is a great one if you've been on the computer a lot, or if you've been in the conference all morning. This little tuck of your head back helps to realign the neck and support good posture. Then let your palms face each other as they float up. And we'll gently take one to the side, following it with your head and coming back to center. Try to keep your torso fairly still and use your head to follow your hand. This gives the neck gentle rotation. And we're only going maybe about 80% as far as you think you can go. So again, this can be a really nice one for releasing tension in the neck, but our goal isn't to push as far as we can. It's just to find that comfy range of movement. And then when you come back to center, take your hands down by the sides to roll and shrug the shoulders. The upper trapezius muscles here and levator scapulae underneath, they often trap tension. Reverse direction. So bringing a little movement here can help release some of that. And then we'll step the feet a little wider than the hips are apart, where you can stay seated in your chair. Knees are soft. We'll take an inhale, scooping up as if you were outside in the leaves, and then putting them down. So you can imagine you're scooping up the leaves and then plunking them down in a pile. And you can also think about gathering up what you need. and letting go of anything you don't. So for those in treatment, it might be gathering up some strength and letting go of stress. Maybe one more like this. And then this next one is a little bit of a brain teaser. I think I heard Jen talk about interrupting thought patterns. And this one's really good at doing that because it's a little tricky. So you imagine you're holding a beach ball out in front of you. You'll take your bottom hand, try to turn the palm outward. Then we're going to press that bottom hand up and the top hand down. And we do the same thing. The bottom palm turns out like you were waving high. And we pass the palms by each other and switch. Yes, and if it feels super goofy, it is. It's a little brain teaser. Whenever we're crossing limbs over the midline, that helps create new connections in the corpus callosum. That's the little bridge in between the right and left hemispheres of the brain. And it can feel super goofy because you probably don't move like this a lot during your everyday life, but creating those new pathways is really beneficial. Maybe one more like this. And then we'll come back to finding that imaginary beach ball. And we'll soften the knees and try to use the torso to turn that beach ball just a couple inches to one side. Then we'll switch the hand that's on top and turn that beach ball over to side two. It's as if you were sitting in between two people and you were going to show the beach ball to one person. You switch the hand and show it to the other person. That's it. We'll go one more each way. This helps support the spine, the rotator muscles that help you find a little twist with the spine. And it can be fantastic for releasing tension in the back. And release the hands down. Think of finding good posture, standing nice and tall. And then keeping that good posture, we'll send toes back and then heel forward. You might move your hands the opposite direction for a little more brain teaser fun. This helps get the synovial fluid moving in the hip joint. And then switching sides. Toes go back, heel comes forward. That's it. And then coming back into center. And next we'll take this one. Imagine you're standing in front of a bird bath and you're going to brush the leaves out of the bird bath. And then you're pressing your hands toward the sidewall. Brush the leaves out of the bird bath and press your hands to the sidewall. If it's comfy, you can step away with the opposite foot. That's it. Brush and press. We'll go one more each way. Again, this one supports healthy hips and gives the shoulders gentle movement. These side-to-side movements are, again, something we don't have in everyday life a whole lot. Coming back to center. And let me just peek how we're doing on time. Okay, so if you're thinking, oh, I really want more movement, you get to see me again, I think at 12 o'clock, 12:15. So I'm gonna turn it back over to you folks, and I'll be back with you in a little bit.
Thank you, Sam.
Hi, this is Amy again. Program coordinator at the Betsy Wright Cancer Resource Center. Thank you, Samantha. That was lovely. And I encourage anybody who's interested in checking out Sam's regular class with us called Be in Motion to give a call. The classes are on Wednesdays and Fridays from 2 to 1. So we are going to.
Amy,
yes.
can you spotlight yourself, please?
Okay. There we go. We're on. I think I'm on speaker view again. Yep. Here we go. So I have the pleasure of introducing our next guest, Judy Donnelly. She is going to be doing a presentation on nutrition and cooking. Judy is a licensed registered dietitian with 20 years of experience working with oncology patients and people with a wide range of health concerns. She joined the Dempsey Center in 2015 and has practiced in a variety of settings, including group work, corporate wellness, cooking classes, and private consultations. She has great passion and skill for helping clients meet their nutritional goals and translating the science of nutrition into wholesome and health supporting habits. And I have had the pleasure in the past couple of months working with Judy to bring her programs from the Dempsey Center to the Beth Wright Center and our clients. So Judy, if you're there, speak up and we will get you started.
Hi, Amy. Am I going to just show up if it's speaker view, or how do we?
You are on speaker view now. I can see you.
Oh, you do? I don't see me. Oh, okay. Well, thank you so much for such a nice introduction. And hello, everybody. I hope it's as beautiful down east as it is down here in Lewiston today. It's bright and sunny, and so happy to be with all of you. So Amy and I had a little discussion about what would be nice recipes to share with you today. And, you know, one of the things that we say a lot in nutrition is to eat a colorful diet. So we've got a nice colorful recipe. But to go along with that, I think that, you know, spices and herbs kind of fall into that colorful food category. And those are foods that really have some great cancer risk reduction, health supporting nutrients in them. So the two recipes that I've picked out, you know, feature some different spice combinations. So how's the volume? Is the volume good for everybody? All right, great. So the first recipe we're gonna do is this roasted vegetable recipe. And what's nice about this roasted vegetable recipe is it's got this great sauce that you combine with the vegetables that are gonna make your kitchen smell really good and make your vegetables just bring out some of those natural flavors of the vegetables. So this is a recipe that I got from Eating Well magazine, and it's roasted root vegetables. So I've got some of my vegetables prepared here. I've got a sweet potato. I was able to pick up these great colorful organic carrots at the store yesterday. We've got several beets here, and I've done just a little bit of prep work. I peeled them and washed them, so they're ready to go. And we've also got some garlic that we're gonna add to the sauce. So the first thing I'm gonna do is just prep my vegetables. You know, we'll start with the sweet potato, and I would say that as we're doing this, there are a lot of different vegetables that you can actually put into this recipe. You could put turnips and rutabagas, which are sort of the same, but they're a little bit of a different family. Those would go really well in here, and any root vegetable really would be lovely. Turnip would be great in here too. So really any combination that suits your fancy. I went with this combination just because there's a lot of different colors, so it's really eye appealing when your final product is done. So I've got this peeled sweet potato and I've cut it in half. Whenever you're chopping vegetables, I think from a safety standpoint, it's nice to put a flat side down on your cutting board so they're not rolling around, and it just keeps your digits safe. So when you're roasting vegetables, you want to cut your vegetables so that they're all about the same size, especially with the root vegetables. If they're all cut about the same size, they're gonna cook at about the same rate and be done about the same time. So that was pretty easy. I've got this lovely little tool. Sometimes it's nice to have a few little kitchen tools that help to move things along a little bit quicker. This is a bench scraper. I think it's most commonly used by bakers, but it just helps to pick up those chopped vegetables and put them to the side in a different bowl. So I've got 3 different carrots here. And what I want to do is talk a little bit about the nutrition quality of some of these vegetables. So we'll start with the sweet potato that's already in the bowl. Orange vegetables have a phytochemical, so a plant chemical in them called beta carotene. And there's been a lot of research about beta carotene. It has some very protective qualities to it. And so sweet potatoes and carrots, orange fruits such as like cantaloupe are all good sources of beta carotene. And it's really a good strategy to try to incorporate the beta carotene rich foods into your weekly diet. You know, 3 or 4 times a week would be a great goal because of all these supportive nutrients that they contain. And it's not just the phytochemicals that we're talking about. So this is a good source of little bit of potassium, and all of these vegetables are good sources of fiber. And we just know so much about fiber right now. You know, anytime you're talking about a diet to, you know, just keep your GI tract healthy and reduce risk of various chronic disease, a high fiber diet is very frequently recommended. And all of these vegetables are gonna add some good fiber to the mix. So we've got our carrots in here and we've got our sweet potato. We're gonna move on to beets. Beets are kind of an interesting vegetable. They contain a phytochemical called betaine. And there's been a little bit of research about betaine with regard to its benefit in just supporting the liver. You know, the liver has a pretty big job. It's got to clean all kinds of different chemicals out of the body. And betaine seems to be a phytochemical that helps to keep the liver healthy. And beets are an excellent source of betaine. They also turn just about everything you touch with beets red. Sometimes people will wear gloves when they're working with them, but honestly, my beets, my hands will be stained red for a day or so, but they will clear up. I always like to just, you know, if you don't eat a lot of beets and it's not a vegetable that you've eaten in the past, I always just like to warn people that beets, when you consume them, will actually have a pretty significant impact on the color of your bowels. So it's just a good warning, because sometimes it can be a little bit startling when people are looking at something pink in the commode. So we've got our vegetables prepped. This is an easy recipe. It would go well with some fish. It would go well with chicken. Whenever I make these, I double the recipe and put 2 sheet pans in the oven because they're really good cold. So you can take the leftovers and serve the leftovers on a salad cold for lunch the next day. And it just puts more vegetables into your diet, and it's quick and easy because the work is all done the day before. So the next step here is to make our little sauce. It's called chamula sauce. And we are gonna start out by dicing up some garlic. I'm gonna mince garlic, actually. And garlic is a vegetable that comes from a family of vegetables called the allium family. And the allium family also includes onions and leeks, scallions. And this family has some very good protective nutrients in them as well. With garlic is kind of interesting. Whenever you're cooking with it, you know, when I'm chopping it, so just a second here, I'm just taking the peeling off. But once I start chopping it, the phytochemical in garlic that has been researched the most is called allicin, ALLICIN. And it's kind of in an inactive form. So I've got this clove, and that nutrient is in its inactive form right now. But if you put it through a garlic press or you chop it, once you start manipulating that clove, it actually activates an enzyme that starts converting allicin, that phytochemical, over to its active form. So one of the things you want to keep in mind when you're cooking with garlic at home is that once you chop your garlic, just let it sit on your cutting board for 5 minutes, 5 to 10 minutes, because it takes a little while for that enzyme to really convert allicin over fully to its active form. And if you automatically take your chopped garlic and throw it into a hot pan, that's going to deactivate the enzyme. And so you don't get the full benefit of that nutrient. So with this particular recipe, I think we're fine because we're not going to be throwing it into the oven right away. But you could put your garlic through a press. I kind of like chopping garlic. It makes me feel like a real chef. You know, I can go through that pile really quickly. I'm not a real chef. I'm just a home cook. But it's kind of fun, and it can be a little stress reduction activity. You know, if you experience any stress, you know, this is kind of a nice way to manage some of that. At least it is for me. So we've got a nice little, that's a lot of garlic here. I don't know how close this is for you guys, but that's a big pile. This is going into my little side dish here. And we are going to add some olive oil. So this is extra virgin olive oil. The difference between an extra virgin olive oil and a light olive oil really doesn't have much to do with the fat content. The fat you get from olive oil is monounsaturated fat predominantly, and it's associated with helping to lower cholesterol. It's got some anti-inflammatory properties, and it has some phytochemicals in it. There's that word again, plant chemicals, called phenolic compounds. And the phenolic compounds have some really health supporting properties. They're anti-inflammatory. And so the difference between extra virgin and a light olive oil is that the extra virgin is the first press of the olives, and that has a much higher concentration of those phenolic compounds than the latter presses, which is where you get your light olive oil. So we're gonna put a 1/4 cup. You can adjust that, you know, if you're a little concerned about calories at all. Fat, you know, regardless of it, whether it's good or bad, is a rich source of calories. So you can adjust that amount down to 2 or 3 tablespoons if you want to. It shouldn't have a big impact on your final product. And then we're gonna add our spices. So we've got 2 spices that we're using here. We've got paprika and we've got ground cumin. And these flavors are going to combine really nice with the vegetables. And we're putting in 2 teaspoons of each. So it's a pretty generous quantity of these spices. And I think that, you know, if working with spices isn't something that you've done a lot with, or maybe these particular spices are a little bit new to you, you can start out with smaller amounts. Taste it, see how it is for you, and then try to build it up if you can, because as I was saying earlier, you know, a lot of these spices are some of the most concentrated sources of supportive phytochemicals that you can be consuming. So learning to use them and get accustomed to the flavors is a great way. It's just kind of experimentation. That's how I learned how to do it. So a couple teaspoons of each. And then some salt. So sometimes when I'm using salt, people will say, wow, I didn't think that salt was good for us. She's using an awful lot of salt. You do need to have sodium or salt. Sodium is what we get from salt. You do need to have that in your diet. And when you're starting out with ingredients like fresh vegetables, and all of our ingredients here have no salt in them, so adding some is really not going to put you in a situation where you're getting excessive amounts of salt. And it's going to help to bring out the natural flavors of that food. So the recipe, I'm going to put in a 1/2 teaspoon. I find that that's enough. And then you guys can kind of play around with that a little bit on your own. And remember, this makes a lot of vegetables, so it's not like you're going to get all that sodium in one meal. So just taking my fork to combine this well. Sometimes I will say when I'm at home, I just combine everything right into the big bowl because it reduces the number of dishes that I have to do at the end. I think you get a little bit better distribution of the spices with the oil and the garlic if you combine them in a separate bowl, but you can definitely do it either way. And it doesn't really make that big of a difference. So we've got our little spice blend that we're adding here. And we'll combine it well. Just wanna, make sure most of your vegetables have a little bit of a coating. Now this can go right onto a sheet pan as is. It's got enough oil on it so that it's, it'll stick a little bit, but that's kind of gives it that browning, that little brown texture. And that's kind of a nice quality to have in your final product. But to save, I'm always trying to save on dishes. I do enough dishes at home. I don't want to do so many dishes at work. So I've got my sheet pan here and some parchment paper. So I'm just going to line this sheet pan with parchment paper. And it's just going to make the cleanup a little bit easier. And don't confuse this with wax paper. As I said, I'm really not a chef, and I did confuse this with wax paper one time, and it wasn't a pretty outcome. So we all make mistakes, So put our roasted veggies on here, and just want to have them in a single layer. You don't want them to be piled upon one another, just because you want them to have good contact with the pan, which is what's going to heat up. So you just want to have them all in one single layer. So truth be told, I actually have a pan of roasted vegetables already cooking in the oven. Just before I came on, they had been in there about 20 minutes. Gave them a little bit of a stir, just to, flip them over a little bit. And so you'll hear this buzzer going off in 2 or 3 minutes here, and that batch will be done. And got a special guest here that we'll do a little taste test together. But these will be ready to go in a little bit later. Amy, any questions that have come up since we started?
No, not from others, but I do have a question I'd like to throw out there to you about spices. And I see that you've used cumin and paprika and some salt. And I'm just wondering, when you think about the benefits of spices on maybe allaying some of the side effects of cancer treatment, say inflammation or digestive issues, are there other spices that you can recommend that people try to introduce into their diet?
Yeah, great question. Well, the first thing that comes to mind certainly is ginger. So for people who are in treatment and even post-treatment, because sometimes those treatment side effects can linger for a little while, ginger can be pretty settling for people who experience nausea. So that's a nice one to add into the mix pretty routinely. Not everybody likes ginger, and I don't think it's really effective for everyone, but it's definitely worth giving it a try. And there's a couple of different ways that you can use it. At the grocery store, you can be in the tea aisle, and there's different types of ginger tea that you can try. There's also crystallized ginger, which is actually sort of a little gummy ginger chew. Some people find that to be very effective in managing their nausea. So that's a good one. And then in terms of other types of herbs and spices, I do steer people in the direction of tea quite frequently. A chamomile tea for anybody who's experiencing some sleeplessness or anxiety. Chamomile is an herb that has a pretty calming effect. Lavender tea also can have a nice calming effect. So yeah, nice question.
Great, thank you. And somebody has asked, how long do you roast your vegetables for now that you've got them in the oven?
Yeah, so they're in the oven. They've been in the oven for 40 minutes now. So I did 20 minutes to start at 425. Let me turn this off. And then I just mixed them around and then I put them in for another 20 minutes. So I'm gonna check them now and see how they're doing. I can find my fork. So I'm just gonna do the fork test, right? You just wanna poke a few of the different vegetables. I would say the sweet potato is probably the firmest vegetable. So that's the one I'm gonna test to see if it's done. Oh, these look really good. And everything is really nice and tender. So I don't know if we can zoom right in on this a little bit, or we might even switch cameras. Okay. You might see your screen might turn black for a second as we shift the cameras that we're using. So you guys, this is like the second time that we've used this technology, but this allows you to kind of see from above, except that little light's in the way, what our vegetables look like. So you can see it's really this beautiful color profile, and I wish you could smell it because it's amazing. And everybody here in the Dempsey Center is wishing that they were here in the kitchen right now. So awesome. We're gonna let these cool off and then my special guest is gonna come and we're gonna do a little taste test. While those are cooling, we're gonna shift to our other recipe. Let me clean things up a little bit here. So you guys all have copies of the recipes. We're gonna be making this avocado chocolate pudding. Really easy.
To be sure, we'll be sending out those 2 recipes in a follow-up email tomorrow.
Oh, perfect. So they don't know the recipes yet.
No.
Okay. So that first recipe, I don't even know if I told you what it was. It's roasted vegetables with chermoula sauce. So that's the name of that recipe. And then this recipe is a chocolate avocado pudding, which we're also going to play around with some spices for this one. So I'll pull in my ingredients here. You guys will see that when you get a copy of the recipe, there's a couple of different versions that you could do.
Judy, just one more quick question about using turmeric in cooking and the benefits as an anti-inflammatory.
Great. Thank you.
Any thoughts on that?
Absolutely. So turmeric, you're right, does have some really great anti-inflammatory benefits. I would say that the human GI tract is not all that efficient at absorbing turmeric. But one of the things that you can do is whenever you're cooking with turmeric, if you combine it with black pepper, the black pepper, the nutrients in the black pepper actually help you to absorb the turmeric a little bit better. So to answer your question, yes, turmeric is great for anti-inflammatory nutrients. Always combine it with a little bit of black pepper to just improve the absorbability of the curcumin. So curcumin is the phytochemical that's in turmeric that seems to have the anti-inflammatory benefits. I think turmeric could actually go into this recipe as well. You can put it in eggs, you can put it in soups. It's a pretty versatile spice to use. So yeah, thank you for that question. So let's see. I'm gonna start out, so this is a recipe that's really easy. It's quite rich. Avocados are another source of healthy fat. So this is a Hass avocado. When you go to pick it out, if it's rock hard, it's not an avocado that's ready to use just yet. When you give it a little squeeze, you just want it to have a little bit of give, sort of like when you're squeezing a tennis ball. So this one is nice. This one's perfect. Sometimes it doesn't work out that way, but today we were lucky. So what I do, it's got a big old pit right in the middle, and I just score. I take a sharp knife and just break the skin and just score around that pit all the way around. And then it very easily just comes apart. And this is so ripe that, you know, you can just, the skin just comes right off. This is like perfect ripeness for a pudding recipe. So avocado is a high-fat food. Similar to olive oil, it's a good source of what we call monounsaturated fat, which, as I said earlier, has some good anti-inflammatory properties, helps to lower cholesterol. So it's good to have in your diet, but it's also, because it's, you know, a rich source of fat, it's also a rich source of calories. So this pudding, I mean, you're gonna make 4 servings. Right? You're going to look at the amount and you're going to be like, well, that's not 4 servings for me. It's very rich. And so you can really get away with a small portion and eat it mindfully and enjoy the flavor, enjoy the heck out of it. But you don't need too much to be satisfied. So I've got a whole avocado in here, a 1/4 cup of unsweetened cocoa. Get the right measuring cup here. This is actually 1/3 cup, so I'm going to use a little bit less than a full 1/3 to get my 1/4 cup. So this is unsweetened. I picked, you know, this is a special dark cocoa. It just gives it a little bit of a richer flavor, but you can use regular cocoa powder as well. And then you're going to see when you get a copy of the recipe, you can use, to sweeten this, because you're going to need something to sweeten it. You can use a 1/4 cup of honey. You can use a 1/4 cup of maple syrup. What I'm going to do is I'm going to use a 1/2 banana, and that is going to allow me to reduce the sugar in half. So I'm going to use 2 tablespoons of maple syrup and a 1/2 banana. And that recipe substitution is right on the printed recipe that you guys will receive. So you can go either way. I really like this. And, you know, yes, there's 2 tablespoons of maple syrup in here, and this is a sugar. But, you know, you're not getting huge amounts of sugar in one portion. And really, it's okay to have a little bit of sugar in your diet. You know, we don't want your diet to be predominantly sugar, because then you're losing out on a lot of nutrition and sort of creating an environment in your body that's high sugar. But when you put a little bit of sugar and it's surrounded by otherwise healthy ingredients, we really don't think that that's a risk factor in terms of cancer. Now you can use whatever milk you want. This calls for 3 tablespoons of milk. I have oat milk here, a plain oat milk, but you can use dairy milk, you can use almond milk. If you use any of the alternatives, any of them are okay. So I'm going to throw 3 tablespoons in here. And, you know, sometimes with the banana, instead of the maple syrup, it requires a little bit more. So I'm just going to put actually 1 more tablespoon in here. And we'll blend it, and we will add more liquid if we need to. And then I'm going to put a 1/2 teaspoon of vanilla. And the secret ingredient that I will be using is not going to be a secret for long, is chili powder. So chili and cocoa, you know, it may sound like a weird combination, but they actually combine together very nicely. So I'm going to put 1/2 teaspoon of chili in here.
Judy, I just want to let you know that we're coming close to the end of your segment. And if anybody has any more questions that you can quickly answer, we can address those now.
Yeah. And this is going to whip up very quickly and we will wrap up. And if we have time to taste test for you, we will. So I'm starting out on a low speed. Just to get everything started. Sometimes if you're using the banana, you have to really kind of push that in a little bit. But everything's blending up now quite nicely. And then for the final push, I just put it on high. So we've got a pretty nice little smooth texture. So I'm bringing in the special guest and we're gonna taste test really quickly. She's been commenting all morning about the smell in the kitchen ever since I put the roasted vegetables in. So this is Jerry. Jerry is our technology expert who has been, let me get you, if you don't mind using that fork. She is the one that makes all of this possible and she's gonna give us her opinion on these roasted vegetables. Oh, so good. So Jerry's not sure. Jerry's not sure if you can hear her, but she said.
Probably not, but it's delicious.
All right. And anything you would say about the spices?
It's perfectly balanced.
Oh my God.
Yeah, yeah.
These are so good. You guys are gonna love this. All right.
All right. Well, thank you so much, Judy. We need to move along, and thank you, Jerry, for tasting. I'm sure
Make
that
the
was.
pudding, you guys. You're gonna like it.
It's really good. I've tried it. I can highly recommend the pudding.
Good
All
to see you
right.
guys. Take care.
All right. Thank you very much.
You're welcome. Bye.
Bye-bye.
Thank you for that. I think I can almost smell those roasted vegetables. I'd like to welcome back Sam Williams to do another demonstration, interactive demonstration for us. Welcome, Sam.
Thanks, Angela. I want to go be one of Judy's special guests. Yeah, hopefully you don't hear my belly growl while while we're moving here. So I thought for this little exercise break, we would talk a little bit about the different types of exercise. You know, you hear all these different exercise programs and things. I'm gonna spotlight myself too, so I'm easier to see. You hear about all these different exercise programs and things people are doing, but they basically fall into 4 categories. The first one is cardiovascular or aerobic exercise. And this is what, you know, going for a walk, a jog, riding a bike, things that get your heart pumping and you can feel your breath going. That's that type of exercise. It's cardiovascular or aerobic. And then strength building, focusing on building more strength in the muscles. That's the lifting weights, or we'll do a little bit of strength in this session with body weight, actually, that can be really useful. Next is stretching. And I like the term mobility versus stretching. Like there's something about stretching, we're like, oh, we really have to stretch that thing. And that's not really the most effective way to stretch. So I like to think of stretching as mobility and strength as stability, because when our bodies have both of those, that helps us to be best in balance. And then the last kind is a very special targeted kind of stability or strength that also ties in some neuromuscular pieces, and that's balance training. So in Be in Motion, we strive to incorporate all 4 of these types of exercise into the class. Again, that's the goal, is to have, you know, a balanced body as best we can to help support the activities and things we want to do and to help us feel our best. So you can just observe, You can do just the arm parts if you'd like to stay seated, or as we have probably been seated for another half an hour, I'd invite you to stand up if that's comfy. And then we'll take maybe a little walk around. And for this walk around, you might stretch up through one arm and then the other. So this is a nice shape if you've been seated to stretch up. And it also helps get the lymph fluid moving in the upper body. For those who've had lymph nodes removed, that can be really helpful. And then we'll take a little bit of gentle cardio. And that can be as simple as a little march. And what I love about marching is you can make it so slow and gentle if it feels like it's a day you need to move gently. You can add a chair or some furniture to hang on to for a little support. Or you can make your march a little more intense if that feels good by lifting the knees up higher and really swinging the arms. So this arm swinging thing also helps get that lymph fluid moving, especially in the upper body. So very useful if you've had a lymph node removed. So you can march and march as long as you like. That helps. You might even start to feel your heart beating a little bit more, or you're taking a little bit more of a breath in. That's that aerobic or cardiovascular exercise. And even something as simple as just getting up to walk across the room and back starts to get that process going. A lot of studies suggest good benefits at 10 minutes. Since we're limited time-wise, we won't go quite that far today, but you could if you needed to. And then we'll talk a little bit about strength building. So one of my favorite exercises to build strength is really simple. And it's called the squat. And if you have a chair handy, a chair is a really useful way to do this exercise and feel safe to have some support, especially if it's newer for you. So we stand in front of the chair and we have our feet pretty close. You're going to engage your core. A really effective way to do that is to imagine your belly has a big diamond drawn on it. When I was a kid, the Care Bears were a big thing. So I think of a Care Bear with like a diamond on its belly. And your hip bones, those front hip bones you can feel here, those are 2 points. You can imagine trying to bring them toward each other. They're not going to move a whole lot. But if you imagine trying to bring them toward each other, it wakes up the deepest layer of your core, the transverse abdominis. And then we can add a little more core support by thinking of a point here near the low ribs, and then a point near the bottom of the torso that we just draw a little closer together. That's also really helpful for your low back. When we engage these muscles here, this helps support the low back. So thinking of those points on the diamond, drawing in, starting to shift your hips back as if you're about to sit in the chair. And then just before you sit, we'll press into the feet and stand back up if you can. You might have felt your legs work. That's strength building, this kind of movement here. You do want to be kind to your knees. If your knees start to bother at the bottom, you might take just the top part. But thinking about that diamond, drawing those points in, that builds core strength. And then shifting the hips back, that helps engage some of these big movers in the legs. Now, this strength is especially functional strength because what do we do during the day? Sit down and stand up. So these are muscles that aren't just for show. Your biceps do things too, of course, but sometimes big biceps are just for show. This is really functional strength that can benefit you in your daily life as you're moving. And if it feels like it's a little bit rough, listen to your body, be kind to your body. Start maybe with just the top or start from the bottom, press into your feet. And for me, I have short legs. I have to scoot near the front of the chair to really press. But press into your legs, hug the diamond in, and see if you could stand either without using the hands or using just a tiny push from the fingertips. That movement helps, again, build strength here in these big movers in the legs and support the core. It can be very useful for grumpy low backs as well. And it's a great one to bring in during the day, anytime you're headed to sit down, like when we get done this session, or later in the day, you're sitting down to a meal, come by your chair and just think of that core diamond and slow, 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 slow sitting down. That's strength. Lots of other ways to do it too. Another favorite, if you have a wall or a table handy, is a wall push. It's essentially a push-up movement, but made a lot easier if we use a wall instead of the floor. You can think of that same core diamond again. Hands go to the wall around shoulder height and usually a little wider than the shoulders. And we try to think of keeping the back and the legs in one long line while we sink toward the wall and then press away. And to make it more difficult, if you wanted more challenge, you would go lower to something like your table or a chair. The lower you go, the more there will be to push. And the higher you go to the wall, the less weight you're working with. But that helps build strength here in the upper body as well. And then our next kind of exercise that's really important is the stretching or the mobility. And we did some of that in our first warm-up. I'd invite you, if you weren't there for that, maybe revisit some shoulder rolls. Stretching doesn't just mean going to hold the muscle in a set position. That's called a static stretch. When we're taking something like a shoulder roll, that's a dynamic stretch, but that's a form of stretching. And then one we frequently bring in to be in motion is this back of the leg stretch, helping to bring in a little length for the calf and back of the leg. You can use a chair, a table, or a wall to imagine you're pushing the wall away. Then we step back with one leg and start to sink your heel down toward the floor. And you can explore a little bit, turning the toes out a little or having them point directly at the wall. That will target different areas of the muscle. You can explore a little bend in the knee that starts to target the muscle that's underneath. That's the soleus. This one's gastrocnemius back in the calf. And this is a stretch that you can hold. This is a static stretch. And you can breathe in towards your belly when you're here. That helps your nervous system feel calm enough to let the muscle find some length. And then we can switch sides when you're ready. So static stretching, this holding, breathing. Static stretching is a great opportunity to be mindful. Oftentimes yoga practices bring in this kind of stretch. And it's really neat to notice what sensation you feel. Notice if you're holding your breath. And if you can breathe into your belly, again, that sends your body the signal to let the stretch happen. And then when you're ready, we'll take our last form of exercise, which is balance. Now, you might stay by the wall. The wall can be your friend and give you a little extra support, or a chair as well. You might explore taking one heel up toward your hip. So we'll try to keep the knee pointed down at the floor, bringing the heel toward the hip. And again, we can hang on for a little more support. Maybe you feel those wobbles. Those wobbles are good. They're work. They're that special kind of strength starting to form in some of the smaller muscles that support us in balance. And some really neat things are happening in your brain and with the proprioceptive nerves that are in the feet. They're talking to each other right now and saying, oh, I can't put more weight in my heel or I'll go over. Go ahead and switch sides if you like. Side two could be really different. That's the case for a lot of us. And if you feel like your balance is super duper steady, you might have a finger or something near a wall just in case. Try closing your eyes. Usually that brings another level of challenge to balance. And then when you're ready, go ahead and bring the foot down. Take a couple more steps, maybe another little reach of the hands up. And I've used up all my time, but if you do have any questions, please feel free. I know they'll be sending out contact information. You can drop me an email anytime. More than happy to help.
Thank you, Sam.
Oh, my pleasure.
Yeah, and Sam, I just want to jump in and thank you. I personally have been going through quite a lot of lower back pain, and any and all ideas to strengthen that is welcomed. So thank you for that today. Before I introduce our last speaker, any other questions or thoughts for Samantha?
Just thank you, Samantha. That was great.
Great.
Oh,
well,
my pleasure.
Thank you, Nadine. And I have the great honor of introducing a dear friend of mine, and I think is an incredible individual to close out this conference. He is, like I said, a dear friend of mine, a Hamden resident, a incredible Christine B. Foundation volunteer that gives at least 15 to 20 hours of his life every week to help others affected by cancer. He has his hands in direct involvement in providing grocery packages, the equivalent to 150,000 meals over the last 20 months. And he wakes up every day choosing joy and hope. And that man is Brian Ross, and he has an incredible story and hopefully some inspiration to share and to talk about his journey with cancer. So Brian, I'm thrilled that you're here, able to speak to your story and hopefully motivate and inspire some of us who are here today.
Thank you, Matt. Certainly appreciate it. It's been a pleasure working with you these last 20 months as well. So it's been a great deal. Again, my name's Brian Ross, local resident, and my journey with cancer started the day before Thanksgiving in 2017, and I couldn't poop. That's what started the whole thing. I was horribly sick and wound up going to the ER, hoping to leave with a bottle of magnesium citrate and spend the next day or so just trying to recover. But unfortunately, I left with a diagnosis of stage 4 neuroendocrine cancer that had metastasized to my liver, to my peritoneum, and ultimately a tumor had broken through the walls of my intestines and blocked my intestine at that point. So that was my first introduction to the world of cancer. It was an immediate surgery, and we thought we got it all. Everything seemed to be going well, and then we found out with another scan that there was actually 4 more spots that they had to go in again, and following another surgery, they went and removed those. Now, neuroendocrine cancer, unfortunately, is really not a curable cancer. It's non-curable, but you can treat the symptoms. And so for the next 3 years, every 28 days, I would wind up going over to cancer care, and again, having a treatment that kept the symptoms at bay, but did nothing to extend my life. At that point, it started out okay, but as 3 years rolled along, things started to deteriorate. During those 3 years, there were a lot of ups and downs. I was very lucky; it wasn't completely debilitating. I attempted to go back to work a couple of times during that period, but unfortunately, the stresses of the job and other things would activate the symptoms and unfortunately put me in a place where I couldn't be a reliable employee. So running along, we wound up having to go on disability. My physical My physical abilities had dropped considerably. I could carry maybe 25 pounds at a time without getting very, very ill afterwards. And it wasn't all bad though. During that period of time, I learned about myself. I learned that I had people that loved me and cared for me that I knew were in my life, but I never realized quite the extent that they wanted to be involved with mine. And so things started to work out relatively well. I never considered myself a survivor. I knew that I had a few years left, and at that point, I wanted to do everything that I possibly could. So rather than a survivor, I call myself a thriver. I had the opportunity to, well, actually, my Matt and I met initially. I was trying to start a thing to feed cancer patients on my own, and a mutual friend said, "Hey, you've got to meet this guy," and so it was the start of a beautiful relationship, Matt. It's at one point I wanted to start a kitchen. Unfortunately, this is also the time that COVID started, so that became difficult. Looking back, I'm really glad I didn't, because physically I may not have been able to maintain the pace that my brain wanted me to do. But I was lucky enough to be able to, again, tie in with Matt. And this is back in about March of 2020. In March of 2020, things were going in two directions. Things were looking up. I had the ability to again, through the Christine B. Foundation, I was able to give back to some of the people that, well, not to the same people, but I was able to give back after having been on the other end, being a receiver. Fantastic. And because of COVID, I was able to I started a Facebook group. Started something very simple, but it's something I was able to do. And all of a sudden, this blossoms, and it's still going today. And I have 11,000 people from around the world that are all part of this wonderful community that is always positive and always supportive. So there was certainly a very positive aspect of things going on, but at the same time, my health was starting to drop even further. Rolls around to approximately October of last year, we actually discovered a new tumor, or one we thought was new. It turned out that it was hidden the entire time over the last 3 years and had been causing so many of the problems. A surgery, removed that one, and all of a sudden, my life changed. For 3 years, I'd woken up every day anticipating, well, at least thinking about my mortality. Knowing that you had a very short period of time going forward, it changes how you look at the world. It changed things that were important. It changed values. It changed goals. It changed relationships. And then all of a sudden, as I've accepted all this, I suddenly find out, Brian, you're not going to die anymore. As a result of that surgery, I haven't had a treatment since. The October 20th was my 1 year in remission. And it's kind of funny. I was thinking earlier, I had a lovely Pomeranian that lived to be 14 years old, and I figured out how old it was in dog years. And we have some cats, and they figure things on cat years. I think they have to figure cancer. They have to be cancer years as well, because this last year has been more than 365 days of just living. It's my first year in, I consider it my first birthday. During this period of time, very, very often when somebody comes to a point where they're either in remission or they're finding that they're cancer free, they're not always in the best shape at that point. It may be the ravages of the disease, maybe the treatment, but very often people will find themselves at that point at a much reduced capacity than they were when they were first diagnosed. I was exactly the opposite. the day after I had my surgery, and when we determined that I was in remission, I'd never been in better physical shape in my entire life. My weight was down, my eating habits were better. I had done so many things to try to extend my life when I knew it was ending. It actually put me into a fantastic place. And at that point, that's when the thriving really started. As a survivor, as a thriver and a survivor, it was a fantastic combination. I learned about humility. There were times when I had to reach out and ask for help that I'd never done in my life. I've learned about compassion, both giving and receiving, and amazed at the amount of compassion that is out there. Again, I said earlier, your values change. So I come out of this surgery, and my entire persona is reduced down to the very basics. All of the tarnish that had built up over 60 years of living was gone. I had reevaluated all aspects of my life, and I found new joy. Now I'm a chef by training and my experience, but I didn't want to go back to doing that world. I didn't want to go back to working nights, weekends, and holidays. And obviously, if you look at it from the perspective of today's, with the way things are today, it would have been horrible trying to go back into the restaurant world with only 3 people to work for when you normally need 10. So I reevaluated where I wanted to go with my life. And at that point, I discovered it was about giving back. Being able to work again with Matt, being able to help people that had been in that position that I had been in before, gave incredible new value to myself. It gave greater joy than I'd actually ever discovered. And then it came time, I was healthy enough. I can go back to work. And I literally spent weeks and weeks and weeks looking at different positions as I went back to work until I finally found one. And to be perfectly honest, you're looking at the office of a lunch lady right now. I run a couple of kitchens for RSU 22 down here in Hamden. But as a chef, it's not exactly the usual career path somebody would go. But as a cancer survivor, it doesn't get any better. I'm out by 2:30 every day, and I'm able to go from here and go again and work with the nutrition packages so we can help. Again, it's been 150,000 meals in the last 20 months. It allows me the ability to maintain a clearer heart, a clearer conscience. It allows me to have the ability to give back, and it's right around the corner from my house. I live only a few miles down the road. When I was younger, I never would have thought that this would have been the point of well, it surely wasn't the career path that I had anticipated. But I told this to Matt yesterday. Matt gave me a ride yesterday, and if we'd gone 10 miles further, I would have continued talking for those 10 miles as well. But I realized that I hadn't stopped talking the entire time. But what really came to mind is as I look back at the 3 years plus of my cancer experience, of waking up every day knowing I was not long for this world. All things said and done, if I had to go back and had a choice of going through that again or not, I'd go through it again in a minute. I'm one of the lucky ones. Believe me, I don't think anybody, a lot of people don't necessarily want to relive their cancer experience. But I was, again, one of the very lucky ones. I came through it a better person, physically, mentally, spiritually. I wouldn't give it up for the world. And I think that's just the best way to paraphrase my entire attitude about the entire experience and being a survivor. I was the lucky one. I came out in good shape, and I've had a great time being able to give back, and far more fulfilling than a bucket of money. Maybe. All right. To be able to give back and have a bucket of money would be nice as well. But again, with the new priorities, I'm 1 year old, and I've got many more years to come. And I certainly anticipate it being a life of giving back and loving. It was a horrible experience. It was a wonderful experience, and I guess that's probably just the best way to phrase it up.
Thank you, Brian. Thank you, thank you. Many people are clapping, and different reactions you might have missed during your talk. Donna shared that she is too a thriver. Dan, just reflecting that you articulate the story and the experience so well. We hear you, and I personally have heard your story so many times, especially last night's car ride that we joked about. But your ongoing bravery and openness, I think, is incredible. And I'm a big believer that vulnerability is a powerful attractor. And so many of us have a cancer experience and a journey, and it takes people like you and others that have spoken, are here today, to be brave and be vulnerable. Nadine, Mark, and Elaine are just sending. Brian, I hope you can see the chat.
I can, yes, thank you.
Okay, great. One big takeaway for me with that, Brian, is the level of humility and compassion, and the levels of that can vary person to person, of course, and what you're equipped to do through treatment and after treatment, but knowing that things are possible, and you can kind of meet the moment wherever you are, you're always a reminder of that. So thank you. We are a little over 12:30, but I know there's a lot going on in the chat. Any questions for Brian? Maybe a quick moment before we bring this to a close. All right. Well, I want to thank not only Brian, but all of the speakers, all of our sponsors, everyone that participated in the planning committee, and everyone that attended today. Thank you so much. I encourage all of you to follow the Beth C. Wright Cancer Resource Center, as well as the Christine B. Foundation on our Facebook pages for upcoming programs and services. A lot of the things we spoke about today, there are no-cost services available throughout the year. I did just now share in the chat a conference evaluation link. We politely ask that you take just a moment of your time, if you have it right after this, to input that into your web browser, complete it. It is a few questions that really help the planning committee steer not only this specific conference, but all of the others in the main cancer series to bring to you. Hopefully we can be meeting in person at some point in the future, but we're so thrilled and glad that we've been able to have this opportunity to come together again in a virtual way to share some resources. So just another reminder, I know Judy had shared some recipes, and there were some other great resources. We just want to remind you that all of those will be shared with you through an email tomorrow, so you have access to them. And I'm sure that they'll be on the maincancerseries.org website as well for you to visit and access to. So with that, I will give you all the rest of your afternoon. And again, thank you for attending, and we hope we see you at the next conference.
Bye-bye.